Good morning. My name is SaSeshen, and we are going to get started with the stream. Today, we're going to talk about healthcare and how it's impacting American lives, citizens, people, our work, everything. How does that impact us as Americans? And the way we're going to talk about it is this kind of commentary. So if you're not interested in the Professor Education Power Hour, come back in an hour. Where we'll start getting into commentating on the different videos. I got my water bottle, I got some snacks, it seems like the mower's finally stopped, so there should not be any interruptions for the remaining of the stream. Hopefully we don't run into those severe technical difficulties that we did yesterday. Again, I apologize, I am still working out the growing pains, if you will. The kinks, as they are called in this endeavor. I do have several channels on YouTube that discuss my political values, positions, how they break down, and so on and so forth. You can find that by going to @SaSeshen, so the YouTube @SaSeshen, or @Ronan for Progress. Either which way, you'll find the political content that your heart desires. For those of you who might be new, however, understand that this channel is going to be a lot less like Hasan losing his mind over whatever issue. It's going to be different than the leftist vets, although I am also a leftist vet. I'm trying to give the perspective of someone who intends to be in office one day, and who has ran for office and who has been on a national debate stage. I want to provide that kind of legitimacy to this space. And also kind of foreshadow where we will be. So yeah, best viewers, my friend. So that's what I want to do. Of course, this is a stream, this is on Twitch, so of course I want to engage with you guys as well. Feel free to debate, feel free to criticize, critique, ask questions, ask for clarification, fact check in real time. Please do, I encourage you to do so. Things that will not be tolerated, however, are discrimination and racism, race baiting, dog whistling, or anything along those lines. Yesterday, we were talking about Palestine and Israel, and we had a viewer who wanted to conflate the religion with race, and that's just, we're not going to do that. So, without further ado, let's talk about some healthcare. The way I would really like to address this is first talking about what healthcare is in America, how it operates, how it's fundamentally, how it operates, how that impacts us as individuals, and then do some comparisons to our country versus other countries. And to that, I have an article where we can go into the nitty-gritty there and do a little bit of, shall we say, live fact-checking from that. The article that we'll be utilizing is from newsmedical.net. I would consider that a reputable source, rather than, liberalnews.org or some other conservative, Newsmax or something, right? So, as someone who wants to serve this country in elected office, where do I stand on the issue of healthcare? Very simple. It should be universal. And when I say universal, I don't mean Medicare for all. I don't mean, something where you go to the hospital and then you also pay a little bit of a fee to go to the hospital, but most of your tax dollars already cover it. I don't mean we just keep the exact same system as it currently is and just replace all the costs with tax dollars. I mean universal healthcare with a complete restructuring. I also mean regular healthcare, dental, eye care, and mental health. If we do not have a comprehensive healthcare system that is accessible, it defeats the purpose. And a lot of the discussion, especially in leftist politics, candidates will talk about, yeah, let's do Medicare for all, but Medicare for all does not cover mental health. And it barely covers dental. And when we're talking about the VA, only retirees get access to dental care. Other veterans get access to mental health, vision, and normal health as long as it's service connected. And so this conversation gets a lot more nuanced when we discuss what is healthcare currently And how could universal healthcare restructure that and make it different? So, to that end, the way healthcare currently is you have your service providers, the hospitals, right? The doctors, the practitioners, the what have you. And then you have your insurance companies, and then you have Medicare and Medicaid, and then you have people. So, the person needs whatever care. They go to receive that care. Without insurance, they have to pay the absolute premium, which is a markup from whatever it usually is. That markup is determined by a base cost, say $50, and that's the price that Medicare pays, right? That $50 that they are charging as a base, keyword there, is what Medicare will pay that medical provider. The federal budget of Medicare pays that, okay? Following. What a hospital will charge you is not that base $50. They will charge you a multiplier. I did not say an additive or anything like that, or a fee, a multiplier. So if it's $50 to get a checkup for, broken foot, right? That hospital will charge you on average triple or quadruple, depending on where you are in the country. And interestingly enough, that's also not universal to the state. So I'm most familiar with Ohio. If you go to Fairfield County for a broken leg, call it $500 base, you'll get charged $1,500. If you go to Columbus, you'll get charged $1,700. If you go to Cleveland, you'll get charged $1,900. If you go to Dayton, you might get charged $1,600. So even within the state, it is not a universal cost system because each individual institution gets to determine its own multiplication table, factor, whatever you want to call it. And that has any number of factors and reasons, which goes into the current healthcare system. Medicare, however, will always pay that institution that base cost, that $500. So, the first thing that needs to be done with regards to a universal healthcare program is address that issue. Second issue is insurance. Insurance exists as an intermediary between you, the patient, and the hospital. Insurance providers get a ridiculous discount to the cost of care that has already been multiplied from the base cost of care. So the insurance is cheap in the sense that you pay for the insurance and you only have to pay 20% of the cost of care versus 100% cost of care. Well, that's because the insurance company only has to pay the 20% because that's the deal that they made with whatever institution or provider. The problem with that system is obviously it's intrinsically flawed and it's intrinsically parasitic. Oh, in order to get this healthcare, you have to pay us money so we can extort the either which way to make it cheaper for you. That's not how that works. Secondly, insurance providers can approve or deny claims based on whatever metric they choose. There is no medical definition when determining whether or not something is approved. It's basically the cost, which means insurance companies have no medical experience, no medical knowledge, no medical licensure, but can still deny you coverage. So if you have cancer, you can literally if you have cancer, you can literally be denied treatment despite your doctor saying, nope, you definitely have cancer. Here's the evidence, here's the proof. Insurance company, if we don't get them started, this will become extremely aggressive quickly, and then the treatment is going to be even worse. And the insurance company can be like, well, it's too expensive. We don't want to deal with it. We don't believe you. Which is ridiculous because, again, there is no basis in medical decision-making on behalf of the insurance company. That's the second thing that needs to be removed. The insurance company, the middle management, the liaisons, they need to be outright removed. That system needs to not exist. So, the third thing is, of course, how does Medicare fund it? How does the federal government fund it? And as to that point, those correlations between the federal government paying for it and the cost of care is where the rubber really hits the road. if we can standardize the cost of care, then we can standardize the federal budget for care in the first place, which then mitigates the need for some sort of intermediary regardless. It can be universal in the truest sense, as in, doesn't matter where you go in this country, a broken foot will cost the same whether it's here or in Los Angeles. Furthermore, your taxes will not have to go up because we already pay for cost of care through the Medicare taxes that we already take federally. So when I talk about a universal healthcare program, that is what I'm talking about. We need to establish a baseline cost for the different types of care that we could possibly come across. And we could even do it by bucket. Cancer, long-term care, respiratory care, podiatry, pediatrics, eye care, mental health care, whatever. We can do buckets. And if you're in the cancer bucket, this is what it'll cost. The government agrees and pays it universally. If you break your foot, this is what we agree on the cost. This is what the government's going to pay. That's what we agree on universally. And in this way, not only will the cost of care go down significantly from the over $4 trillion a year that it costs taxpayers and citizens, it'll also be, there's no other word to say it other than universal. It'll be the same no matter where you go. The thought process, the decision making of, can I deal with it? It doesn't matter. And it'll also help with the budgeting, right? Because conservatives love to talk about the budget and responsible spending. Well, it doesn't get more responsible than balancing the books and establishing a price and keeping it at that price. And we can certainly have the debate on whether or not inflation costs get involved, or we can discuss, well, how are we going to pay for doctors and nurses? Okay, fair point. How are we going to pay for doctors and nurses? Again, the base cost of care will take all of that into consideration. It'll take into let me break that down further. When I say the base cost of care is $500, that means between running the hospital, running the equipment, paying the doctor, paying the nurse, the janitor, the staff, the whole kit and caboodle, right? Broken down into its, constituent components. And for the amount of broken feet that you might run into in a given year or cycle, plus the cost for operating in that particular area of the country, on average, should be $500 for the sake of argument. So every time you do get a broken foot and you go to the hospital and you get your foot fixed, it pays for everything equally. Same thing if you get cancer, same thing if you do just a regular annual checkup. Those things would all be taken into account, just like any other business. The difference is businesses are for profit, and so they will make efforts to ensure that they can cut as many costs as possible to not dig into their bottom line, right? Which is the system that we currently have, which is why insurance companies are like, nope, we're going to deny healthcare, we're going to deny cancer treatment, we're going to deny this, that, or the other because it's expensive, and we want to, buy our third yacht or something stupid. When it is a public institution, right? Publicly owned, publicly funded by we the people, right? We can call it big government if you want, but there's a difference between state institution and public institution. The point I'm trying to make here is as long as it's publicly funded, right? As long as there is that oversight and that accountability and that agreed upon universality, the overall cost of care will be significantly less to the taxpayer, the federal budget, and we'll be in control. So, with that being said, how does that integrate with healthcare, since that's typically not involved, and dental healthcare, because that's also not involved? Fair question. Because we have standardized the cost of care, and because we've established this as the baseline no matter where it's happening, and we've also established that cost of care is different all across the country, we can safely assume that the overall cost of care, even at the base level, is higher than what it should be across the board. And that difference, whether, I believe the Medicare budget currently is like 1.5 trillion, give or take a couple $100 billion. that give or take $100 billion, $200 billion would be more than sufficient to cover the cost of dental and mental health care. And that's the other thing too. When you think of a system, right? When you think of an organization and you break it down to the building is not going to change. That is immutable. The personnel might be, and the equipment might be, and the accessibility might be, but the building isn't. It's the amount of personnel that you need. And so if you can account for the personnel cost and derive from that a cost of care, you can balance the books. And at worst, the Medicare that you're already paying out of your tax dollars, but that is capped at $150,000 annual wage, that cap would just simply need to be raised, as in the wage cap that pays into it. Not your taxes, not my taxes, but the higher taxpayer taxes will just continue paying into it after $150,000. And that is how you actually achieve a universal healthcare system in America. That is how you fund it. That is how you provide for it. That is intrinsically the purpose behind it. That if we are going to be a country and pay taxes into anything, it should at least serve the needs of the many, the people, right? If it isn't, then why have that organization, that government in place at all? And that goes into a much different debate. So, to recap, the current healthcare system is extremely predatory. It is parasitic in nature, and the cost per capita is dramatically more in America than what it is anywhere else in the world. In order to resolve this, we need to do three things: standardize the baseline cost of care, expand the care to include dental and mental health, and then establish this process for the entire country. Do these things. No, I'm sorry, four things. Expand the income that pays into Medicare to be uncapped. Do these things, these four things, and we can have universal healthcare in our time without really fundamentally changing the infrastructure, just really the finances involved. So how would that compare to other healthcare systems throughout the world? So again, news-medical.net is the article that I'm reading. It goes /health/healthcare systems around the world.aspx. So actually, what we should do, right, is is add it to this this particular scene, right? So we'll paste as a new source, and we will look at this together. And we'll make it not cover my face. Perfect. So healthcare in the US, just like I described, privately owned, 60% being nonprofits and another fifth being for-profit facilities. Coverage by federal and state programs is partial, and most insured Americans have employment-based private insurance. That is true. That is a point that I forgot to bring up, and I do apologize. Our healthcare system is predominantly employment-based. Yes, I'm certain there are some few of you that are watching that are like, well, I have my own, I pay for myself. It's like, well, that's great. But for the most part, if you don't have a job that provides healthcare, you don't have healthcare. You can pay into an HSA account on your own and hope for the best. But again, if you're not employed, you can't put money into it, correct? Correct. Which therefore means healthcare in America is entirely dominated by the employer, which is another problem, because when the control of your well-being is not in your hands, but someone else's, and especially an institution, what do you think happens? It's exactly what's been happening. The greatest cause for bankruptcy in America is healthcare expenditure, and the highest or the biggest reason for not having health insurance is due to unemployment. Right? So, universal healthcare obviously resolves that issue outright. It also means, economically speaking, you don't have to stay at that job that you hate, dealing with the boss that you despise, who micromanages and is just an outright terror, just so you can take care of yourself and your loved ones. Because isn't that often the threat that you hear? Well, if you quit, you're going to lose your healthcare, and then little Timmy's not going to be able to go to the hospital. It takes away power from the capitalist ruling class. And that is something they clearly don't want, because we had, to a degree, a universal healthcare program in the 1950s, 1960s, until Nixon, not Reagan surprisingly, but Nixon passed the Healthcare Reform Act, which basically privatized it. So what really gets me is that people don't know that. What gets me is that we have been misled and taught differently, that this is just the way it's always been, but it's not. We've had universal healthcare in this country, and we can have it again. Just like hemp was America's #1 cash crop, and it can be again. In fact, if we treated hemp, and this is, I promise this ties in, if we treated hemp the same way we treat corn, 90% for industrial uses, 10% for consumption, and then integrate hemp into the crop rotation cycle, it would generate $1.5 trillion per yield. And what did I say our Medicare costs were currently? About $1.5 trillion. So in a single 3 or 4 month rotation of growing hemp and related, the flower, the bud, the stem, the whatever, we could fully fund our healthcare system. Granted, we could fund it in a year by universally legalizing hemp growth and integrating it into our economy regardless, but that would be ludicrously wasteful. And it would reward the predatory, parasitic, bad actors, the administrations running these hospitals, and the insurance companies who are extorting citizens and gatekeeping care. If we just gave them all that money anyway, they would still be doing all that thing and being significantly richer on top of it. Whereas we could take a third of that money, cover our cost of care outright, and then have another $3 trillion left over to, I don't know, research better healthcare practices, invest in our communities, invest in our healthier lifestyles, start introducing healthier agricultural practices, breaking up Monsanto and the other major corporations who dominate our agriculture. I'm just saying, there are more than one ways to skin this cat. We can eliminate the cap, the taxation cap for Medicare, and have it solvent regardless. We can legalize hemp products across the country, pay for it in triplicate regardless. In addition to the taxes, that would be $6 trillion. Imagine what you could do with $6 trillion. We could be catching up to the rest of the world in other ways. High-speed rail, improving our cities, walkable cities, reintegrating nature like trees around our buildings to cut down on AC and heating costs throughout the seasons. There's a myriad different ways that healthcare becoming universal can impact other facets of our society and our economy for the better. And that is the argument that really needs to be hit home. Most people think that a policy issue is singular or insular. That might be a better way of describing it. They're not. They're interconnected. If you raise the minimum wage, right, people have better spending power. When people have better spending power, they can take care of themselves better, which improves their health, which means they're spending less time going to a hospital, less time taking up hospital resources, which means less time needing to spend into their insurance and needing to pay for copays, which means the insurance companies aren't making as much money beyond their premiums, which means they either raise rates or do something else, which means hospitals have to do something else. And then that ties into pharmaceuticals, agriculture, and all the other things that tie into our economy, right? Emissions, for instance, right? If we never improved our emission standards, we would be having much more health-related problems in our cities, as the rate of automobiles usage in our country has only ever increased. It has never decreased, which a solution to that problem would be high-speed rail. High-speed rail would make our country significantly smaller. The ability to go from California to Boston, Los Angeles to Boston, on a high-speed rail that could go up to, 300 miles per hour would be a 10-hour train ride. Imagine if you could transport goods cargo. Hundreds upon thousands of tons of cargo from the East Coast to the West Coast in 10 hours. Imagine what that could do for our agriculture, for our food supply, for exercise, for literally anything, being able to travel to other parts of the country, commuting to work, being able to be more selective in where you work and where you live, where you choose to eat food. It would dramatically reduce the cost of food, dramatically reduce the cost of fuel. It would reduce emissions in our cities, because now people aren't needing to rely on cars. They're not needing to rely on airports. Airports would become significantly less congested. And for direct travel that needs to be done quickly, you would have hubs and be able to hop rather than have to rely entirely on one or the other. So universal healthcare, by taking the remaining $3.5 trillion that we're currently spending on the $4.5 trillion US healthcare system, we could be reinvesting that in other ways. Universal healthcare is tied into labor rights. It is tied into civil rights. It is tied into the economy. It is tied into our foreign policy. It is tied into every facet of our life, just like they are also tied into everything else. If you don't have gender equality, how are you going to achieve universal healthcare? If you don't have affordable living conditions, how can you possibly improve mass transit? If you don't deal with emission standards, how is that going to impact universal education? Right? It may seem as though these things are disconnected, but if you look far enough, it's a matter of funding, willingness to integrate into an infrastructure, and to provide support as a society to benefit society. And when you start looking at it from that context, you'll see that everything around us, from what we consume to what we buy to our jobs, to how much we are suppressed in this country, it is by design. We are constantly pushed to be divided, to be stressed, and to be distracted. And it's because if we actually focused on the real issues and how things should be and could be, well, we would dramatically change the way things are, wouldn't we? So, going back to the article. Private insurance, this is still the United States. Actually, that would be kind of interesting what this article has to say about the good and the bad here. Among 11 high-income countries, the U.S. healthcare system is the most expensive, with 17% of the GDP being spent on healthcare in 2018. Now, 2018 GDP, just type that out real quick. 2018 GDP US. Whoops. Bumped my webcam. It was 20.53 trillion, so 17% of that would actually have been, at that time, almost 4 trillion, 3.5 trillion. Of course, times have changed, and it's closer to the 4.5 trillion now. So, its a rate of specialized scans and MRI are among the highest in the world. Oh, I see. Its rate of, the cost of, I see. So is its utilization of hip replacements, influenza vaccines, and breast cancer screenings. However, among developed countries, the American system is among the least accessible, efficient, and equitable. The number of physicians and rate of physician visits is among the lowest. Ethnic and disadvantaged social groups suffer massive inequalities. Remember how I said universal health care is also a civil rights issue? There it is. Well, let's see. Right there. There it is. About 14% of Americans were uninsured against illness at the end of 2018, causing an estimated 60,000 avoidable deaths. So, again, poverty, lack of resources, low wages, high cost of living, etc., is a direct relation to healthcare. Its efficiency, its efficacy, and its availability. A universal healthcare system would have saved 60,000 American lives. And in fact, as president or even as a congressman, I would introduce legislation or sign legislation, as the case may be, to hold insurance companies and hospitals, the US healthcare system, criminally accountable, involuntary manslaughter for those 60,000 deaths in 2018 alone. And of course, up to and including the deaths from the moment that bill was signed. Because if we don't hold them accountable, then they basically got away with murder. And by the way, 60,000 sounds like a small number compared to 27 million uninsured, compared to 330 million US population. 60,000 people dead is greater than the population of Salem, Massachusetts. So imagine, if you will, the entire city of Salem, Massachusetts dropping dead in 2018. That should infuriate you. That should disgust you. And that should make you want to change the way our healthcare system is and actually fight for and encourage to your congressmen, to your leaders, your elected officials, to push for these initiatives. Because 1.5 Salem, Massachusetts are gone every single year. In fact, it's probably been more now as the years have progressed. Dayton, Ohio, last I checked, had a 90,000 person population. That's probably the current rate of death, preventable death, from our healthcare system. And when you start putting that into perspective, it's appalling that we have industries in this country that get away with murder as part of their business model. High medical costs have led to bankruptcy for a fourth of senior citizens, which is the other thing I said. It's one of the biggest issues is bankruptcy. Preventable and lifestyle conditions such as obesity, hypertension, and diabetes are rampant. This indicates poor access to primary care and primary prevention of disease compared to its peers. Again, food and access, right? The quality of what we consume and the access to the healthcare in the first place is the number one contributor to our poor and declining health, and unfortunately, our life expectancy as well. Our life expectancy has actually been declining over the years, in addition to all of these other problems. Meanwhile, US suicide rates are highest among all members of the Organizations for Economic Cooperation and Development. That's also disturbing. That was a statistic I was not aware of. And again, it's because mental health care is the least accessible form of health care because there is no insurance for it. You got to pay straight out for your care. If you're a veteran, great, you get to go to the VA if they can schedule you and if they can fit you in. But if you need more specialized care, you have to go out of the VA and be assigned there and to a greater or lesser degree pay for it. So an average citizen, how are you going to afford that? And again, what is the cause of suicide? Depression, right? Anxiety, stress. And what causes those things? Financial concerns, work-related concerns, right? There are certainly internal concerns. I'm not saying it's only capitalism's fault. But then again, most of it, I would say, is. Unless you truly have, and I want to phrase this delicately, unless you truly have a mental health situation that leads to depression, you're not going to be suicidal. One moment, please. Sorry about that. We're back. Speaking of healthcare and economic crises, living in an apartment in the middle of the summer when you have a wall unit that is built into the wall by the apartment tends to be pretty difficult to contend with as the temperature rises and the unit is not necessarily capable of keeping your space cool, which is an interesting point with regards to healthcare systems, or what is actually part of the healthcare discussion is when you are living in America, right? Unless you own your own home, there are minimum standards that a residential facility must abide by. None of them include air conditioning, and none of them require central heating and air either. It's just that whatever system is in place must provide heat so that in the winter it is at least 65 degrees. That's because you will freeze to death, obviously. But you can also die from heat exposure, right? There's heat exhaustion, there's heat stroke, you name it, all sorts of things. So AC is just as important as everything else in America, which goes back to the whole healthcare aspect, right? If you're poor and you're living in, shall we say, a slumlord apartment building, who they just do not care about you other than that you pay their rent on time, and your AC goes out, most states will not cover that. And then you will start suffering from heat exhaustion, fatigue, all these other things, which will deteriorate your health, which you won't be able to get taken care of because you don't have access to healthcare in the first place. So again, when we talk about healthcare, and when we talk about the state of our nation and what it takes to live and survive in this country, just being in an apartment alone, the fact that the laws do not cover AC during the summer where you can just as easily die from heat exhaustion or stroke or exposure is very indicative that our institutions, our industries, do not care about helping you or me or us collectively. And those are the things that we need to be addressing. Universal healthcare is a step in the right direction. Housing standards, including AC in the summer, mandating that they must be modern with central air and central heat, is a step in the right direction. Mandatory profit sharing, rather than record profits and record layoffs. Raising the minimum wage and tying it to CEO pay. Removing any sort of cap for social programs in regards to taxation. I don't know, reducing the tax burden on the middle class and raising it on the owner class, right? The top 10% of earners should be the ones who are paying the most in taxes, right? If the working class is doing the work for the social contract and the moneyed class is not, and also not paying taxes, then what are they there for? What purpose do they serve other than to extort and benefit from our work, our labor? Right? All of these things are interconnected. Back to the article. Overall, the US healthcare system allows providers to inflate prices and expensive services, but poorly compensates essential services such as primary care and behavioral advice. It also draws healthcare services away from rural and poor communities, which is literally what I spent this entire stream talking about. Interestingly enough, the US leads in medical innovation, boasting many of the world's leading hospitals. For those who can pay, it provides high-quality care. And that is the crux of the argument. If you have money, you get to experience the American dream. You can have a nice house, cars, vacations, time with your family, good health, and education, the opportunity to progress. If not, sucks to suck. Everything about our country is designed for regular people to fail, to struggle, and to suffer. And as someone who wants to be in a position to mitigate and or outright eliminate that, it is appalling to me that it's taking this much effort for any of us to be heard and to get these things changed. They should be changed outright because they exist, and any country, any elected official, any politician should see these things and be like, yep, that's not a good thing and we should fix it. Not only would they immediately be a hero across the country, they would also have done the right thing, which is ironic because that's also their job. A politician isn't there to enrich themselves or to cater to their donor base. Their job is to serve their country, which means serving the citizens of said country, which means ensuring that the lowest common denominator has their basic needs met and exceeded. And the more they are exceeded, the more prosperous as a whole the country becomes. But that's not the point of the American governments or our economy. Evidently, what we want in this country and the way we are being ran and operated is to keep people as suppressed as possible so that a very, very, very few can benefit from that and keep that cycle going in perpetuity. And that is unacceptable. Now, back to the specific healthcare. The UK national system, I would like to just skip to the good and the bad. Universal free healthcare is widely considered to be good for the country, health-wise as well as economically. NHS provides free healthcare for all and higher life expectancy than in the US at half the cost. So outright, it's half the cost. Patient satisfaction is relatively high at 61% compared to 29%. Taxes for healthcare may appear higher, but are actually equivalent to the total medical expenses in the US. Again, that 17% GDP is going to corporate pockets. It's going into their pockets in the form of bonuses, executive pay, administrative pay, the insurance companies, which are again parasites on society. If that money would be redistributed to literally anything else, we would have exponentially more, and then this comparison would be a little different. Austerity cuts have led to a reluctance to recruit staff and to upgrade equipment, which may eventually affect the quality of care. Waiting times for consultations and surgeries are long. And again, this goes to the privatization. By not investing or encouraging investment and retention or training or what have you in the healthcare system, it's falling apart, which goes back to yesterday's stream, which is your democracy is only as strong as the people who are participating in it. And the people who are participating in it will ultimately drive the way that democracy functions, operates, looks, and feels. So if the only participants are your boss, landlords, CEOs, and corrupt politicians, guess what our government's going to look like? Something that enables all of the above. If you want a country and a government that provides healthcare, provides education, clean water, quality living conditions, accessible transportation, affordable communications such as internet and phone services, electricity, then you have to participate and demand these things. Support candidates who want those things. Become a candidate who wants those things and fight for them. And let people know, but also support them. If we allow ourselves to continue to fall into this us versus them, red versus blue, Democrats versus Republicans, there's nothing we can do about the duopoly system, then well, guess what? We won't. And it will remain the way things are. But if you want change, and if you want to affect change, and if you want to impact your life and take back control of it, universal healthcare is one of the first things you can do to demand from every single one of your elected officials. The third issue is health tourism, where non-residents exploit the NHS to get high-quality medical care at a lower cost than is available where they live, but without a corresponding contribution to taxes. Now that's true. That is a valid criticism. Health tourism is, I'm fairly certain, predominantly something Americans do, but we can get into that at some time. But it is actually cheaper to buy a ticket to Europe, stay in a hotel in somewhere in England, and get your cancer treatment than it is anywhere in this country, which is appalling. It's shameful. It's actually disgraceful that that is how pathetic our healthcare system is. That citizens have to go to other countries, spend half of what they would on care here, and get the same treatment at the same level of quality and be on a mini vacation. That is insane. That's actually disrespectful. That is insulting that is where we are as a country. And of course, Grandpa England, ethnic minorities and the poor face inequality in the healthcare system. Social care measures need to be implemented, because where did slavery and racism start? Well, that's not fair. Where was it perfected? The old England. So healthcare in the European Union, each country has its own healthcare system. However, EU members generally share the same goal as the UK model. So let's go to the good and the bad. Most EU members enjoy the approval of the majority of their people for their healthcare systems, with less than 5% of people in 4/5 of European countries reporting unmet needs. National health systems tend to control costs better. Again, if there was a number one issue, it is the cost. I do, because you do have to pay the doctors and the nurses, and you have to run the facility, and you have to power the equipment. Unfortunately, we're not in Star Trek society yet. Money matters. So cost, I do believe, is the number one problem that we face with regards to a healthcare system, universal or otherwise. And it is also fact that if it is publicly funded, i.e., and this is where we get into the nuance of vocabulary, whether it's government funded, publicly owned, whatever, when there is citizen oversight, when there are actual aspects of accountability and oversight and auditing, it is better handled. And that money is going to where it needs to go. The introduction of internal markets may increase the healthcare economy and efficiency. That is false, because now you're trying to recreate a private sector within the public sector, which is insane. I'm gonna have to change the font, because I cannot read that. I think it's Oshun. And if that is the case, still can't read that. More opacity. I guess we're gonna let's see. It's kind of better. What if we just do, there we go, green. Just go full green. All right. Oshun, yes, you lived in Norway and healthcare was excellent. Exactly, because healthcare is actually designed to cater to the people, not to some private industry. And that's the point. Let's see. Nonetheless, funding pressures are likely to go up as patients expect more advanced treatments and as technology develops. The graying of Europe may impede fund flows to these programs, given that about 70% of the funding comes from the public sector in most countries. Again, eliminate the cap on the rich, and it is infinitely solvent. Infinitely solvent. Like, that. If rich people control 90% of all wealth in any given capitalist society, taxing people more isn't gonna make up for it. Taxing them will. At the same time, aging is associated with different patterns of disease, typically conditions that are both preventable and care intensive. As age increases, however, social welfare tends to absorb most of the costs. Again, a society with social safety nets ensures the longevity of its people, but also takes care of their people. And those are things that do not exist in this country in a way that makes any amount of sense. Audits of spending efficiency will be crucial to enhancing the spending power of each euro. The OECD estimates that 1/5 of health expenditure makes little or no contribution to improving people's health. Again, if you focus more on administrative costs and the board of the hospital, rather than listening to the doctors, nurses, and techs that are doing the job, that's what you get. Yikes. Inequalities in health status and inequity in healthcare finance and delivery continue to plague the system in many EU nations. So we're seeing a trend as well. Western healthcare systems are racist and discriminatory against poor people. That's not hyperbole. That is statistical, verifiable fact. That if you are poor or brown, and in many cases just happen to be a woman, you are going to get less effective care than someone with my demographic, which is insane. Now, I believe this next one is Asian systems. Is it going to do the good and the bad? No. Okay. So let's go to Singapore. Premiums are subsidized, which helps. Compulsory national health savings is kind of like mandating health insurance, but not doing anything to mitigate the cost of insurance and allowing insurance companies to raise their prices exponentially and for no reason whatsoever, while also not being held accountable for their actions. So that's a problem. Thus, the government, healthcare providers, and patients all share the responsibility for healthcare coverage. A multi-payer financing system. While competition and market forces enhance the quality of healthcare, the government strictly regulates the costs when they begin to rise beyond affordable rates. Which, that's kind of like wanting your cake and eating it too. And it's, in my humble opinion, and shared with quite a few others, that if it is necessary in order for a human being to live, it should not be for profit. It should be controlled by a private entity or institution. Period. Dot. The free market will never regulate itself. It will only ever extort and extract for its own benefit. And America is the number one example of that being true. The Ministry of Health also plans for workforce strength training and land allotment for healthcare facilities. Again, that one right there, that's a good one. That is fantastic. We have a nurse shortage in America, a doctor shortage in America. Healthcare workers in general is a shortage in America. One day I'll be able to speak. And what are we doing as a country about it? Literally nothing. We are not encouraging students to take those courses. We're not mandating higher salaries for entry-level positions. We're not encouraging or creating apprenticeship programs or other sort of training programs. We're doing nothing to address this issue other than saying it's an issue and dang, that's a problem, while 60,000 plus people die every single year. Let's see. The system's centralized nature keeps administrative costs low and simplifies procedures. Again, right there. You cut out all the chaff. You get rid of all of the parasites and liaisons and the admin this and the executive board that. All of a sudden, things start to work. Here's the thing about big government and publicly funding and federal funding and all this, that, and the other. All that means is here's big bucket money. In fact, here we go. Here's all the cookies that we can allocate to healthcare. This state spent 1 cookie's worth. This state spent 2 cookies worth. There's still plenty of damn cookies to go around. Some states might only need half a cookie, a quarter of a cookie. Some states, might need 5 cookies for 1 year. 3 years the next. 1 the year after that, and then it keeps going down because their citizens are finally getting taken care of. But if this is the federal budget in healthcare, and you're giving this many cookies to administration fees and insurance companies and distributing this to the people who need it, yeah, no kidding, you're going to have inefficiencies. All right, so here's one. China, America's biggest rival. China has almost universal publicly funded medical insurance, with urban employees enrolled in employment-based programs. Others enroll voluntarily for basic subsidized medical insurance. Comprehensive healthcare is covered, but deductibles and co-payments apply. There is also a ceiling on reimbursement. For-profit private insurance is also available for services not covered by public insurance. Patients share costs for physician visits, inpatient care, and prescription drugs, which are uncapped. China spends 6.6 on its healthcare, with 28% being funded by central and local governments, 28% out of pocket, and 44% by public or private insurance and social health donations. These form part of a medical assistance program for the poor. That's awful, actually. I thought of any of the countries that would have been listed on this, China being communist and whatever else, would have had the exact opposite of the U.S. healthcare system. But as we can see, it's very much so similar. It's not the same. They don't spend as much, and there is significantly more public funding involved, but it's for profit, and that's actually quite shocking. Shame on you, China. How are you going to be the communist country of the world for everyone else to view and look upon, and literally have a healthcare system equatable to the United States? That's terrible. And of course, wide inequalities. China also has racial and discrimination issues. India provides universal free outpatient and inpatient care at government clinics and hospitals. States are in charge of organizing their healthcare services. However, government facilities are notoriously understaffed and ill-equipped, so that most people pay out of pocket for private healthcare. The National Health Protection Scheme, I'm not going to attempt to pronounce all that, was recently launched to attempt to address this. It supersedes the earlier underperforming National Health Insurance Program. The PMJ program is financed by taxes and enables free secondary and tertiary care at private hospitals. It envisages grassroots health and wellness centers while providing cashless hospital care for the 40% of people who live below the poverty line. Government workers and most formal employees have their own health insurance schemes. A few private health insurance providers also exist with limited uptake. Less than 40% of Indians are insured. The situation is worsened by the poor quality of healthcare services and the shortage of doctors and equipment, corruption, as in many developing countries, along with accessibility issues, which exacerbates these drawbacks. It also spends a lot less, and out-of-pocket payments at private hospitals may make up 75% of the total expenditure, in stark contrast to other poor countries. Yikes, also. Especially considering between India and China, that is a quarter of the global population. So a quarter of the global population has a healthcare system that is similar to the US healthcare system, but in India's case, not nearly as well equipped, and in China's case, I don't know how to summarize it. It's like they want to have support, but they're not doing it. I'm not understanding that. I truly don't understand the Chinese healthcare system, because it should have the capability of having high quality care like Europe with the same funding model as Europe. But instead, it's mimicking America, and India is mimicking America without any of the technological benefits. So when you compare healthcare systems, it goes very clearly Europe, probably China, America, India, and then underdeveloped countries. Obviously, we haven't gotten into Africa or South America yet. Australia. Once again, we're seeing just there's universal health care, but racial discrimination towards specifically indigenous and aboriginal populations. I'm surprised Japan wasn't specifically mentioned in this. So we got South America, Colombia. South American healthcare, it covers almost 97% of its population by mandatory universal healthcare insurance. All citizens have access to the same healthcare services, with only 14% of out-of-pocket spending. The health system is financed through taxes and employment insurance and fully subsidizes the poor. Both public and private insurers are involved, and providers are also belong to both public and private sectors, with a healthy competition between the two. Again, I don't believe that there should be competition. There should be publicly funded. But it's working for them. Let's see. Supply side subsidies and provide uniform coverage for all. So that's good. They are actually working towards it, which is what they're supposed to do. Performance management, accountability, and efficiency need to be improved to build on these gains, which is fair across any healthcare system in any institution. There is no such thing as a perfect healthcare system, in the sense that even if the cookies were able to fund everything, or you just kept increasing the number of cookies to cover whatever else, if the care isn't of high enough quality, and if the technology and equipment isn't of high enough quality, it doesn't matter that you can pay for it. It doesn't do you any good. And technology is ever improving, medicine is ever improving, practices are ever improving, and even if you had a fully staffed, fully equipped hospital in every city in America and infinite cookies, that doesn't mean there isn't room for improvement. That doesn't mean you can't make those institutions more efficient. Solar panels. I love me some solar. I love me some clean energy. Stick them bad boys on every single hospital. Cut down on electricity costs. Cut down on the environmental impact, right? Make your ambulances and all that fun stuff electric instead of gas or diesel. Same thing with helicopters and whatever have you. Improve the training programs. Increase the number of staff. Be overstaffed, significantly overstaffed, and improve rotation cycles. Instead of, 12, 16, 20-hour shifts. Do 6-hour shifts, do 4-hour shifts. If ever there was an excuse and a reason to work less than 40 hours a week, 8 hours a day, it would be in the healthcare system, who are already overworked and overburdened and significantly underpaid, right? There's always improvements that can be done to the system. Eventually lowering the cost of care. Eventually, something. There is no such thing as a perfect healthcare system, but there are good systems. Chile. Statutory health insurance for workers with no employer or government contribution. Yikes. The health funds are managed by Social Security health institutions. The rest of the population is covered by a public fund manager, FONASA. These cover healthcare payments, which, that sounds awful. That sounds scary, in fact. Brazil has a government-run universal program. Great. While the federal contribution is about 43% of total public health, municipalities contribute almost a third. So that's good. So 43% at the federal level, local areas at around a third. That is about 76% public funding. That's not bad at all. Covers all forms of healthcare for citizens and visitors. However, wait times are unreasonably long at all stages, leading to out-of-pocket spending for basic care. Again, if you don't have the personnel and the facilities to support the care, it doesn't matter that you're funding it well. Ooh, and the lack of drug availability. That's not good either. Okay, Costa Rica. 86% of the population has access, which is nice. Which is delivered free, which is even nicer. The rest are able to pay for care. Doesn't really go into it too, but I imagine they're running into the same problems of accessibility. Chiefly by workers' unions. That's awesome. While over a third of the population is uninsured and depend on public health care. The uninsured part shouldn't matter in a universal healthcare system, but I get why in a mixed system that makes a difference. South American healthcare systems suffer from poor resources, which are badly distributed to cover some areas. The capacity of the systems is low, and drug shortages are common. Corruption vitiates the process of official appointment and hampers reforms. And guess what privatization of these systems do as well? Encourages corruption. And then we got Africa. Let's see. Is there going to be a good and the bad for this? I said the same thing. No, there's not a good and the bad, but it's going to go over some of those as well. Let's see. Sub-Saharan Africa has 13% of the world's population, but carries a fourth of the world's disease burden. Yikes. However, it spends only 1% of the global health expenditure. 3 out of 4 Africans have a per capita income of below $2 a day, and almost half spend less than $1 a day, Universal free healthcare is a right that is agreed to by all, but it's slow to become reality. That's interesting. Most Africans that are either low or middle income turn to the public healthcare system or traditional healers. Only a few are able to afford high-quality private care, but nonetheless out of pocket. Private spending accounts for 60% of all payments, just like the US, or actually less than the US, I believe it was. Half of private healthcare expenditure is spent on private providers, and 40% pay for care from for-profit providers. In Rwanda, the national health insurance covers 90%, which is great, but not so great that it's less than 9% in other countries. Ghana has a national insurance scheme and built a public-private partnership to reach areas without public health services, which is fine, but again, with a universal healthcare system, the idea is to be able to reach the more remote areas of a given country, state, or locality. Obviously, Ghana does not have the same resources as the United States of America, which is why they're doing this, but ideally, that's how things will end up. All residents must enroll and pay an annual premium in return for free care. Exactly. You raise the cap. Don't put the burden on citizens, put the burden on the population equally, or disproportionately on the wealthy. Yes, tax the rich more. Absolutely. In Kenya, a similar system. Tanzania as well. Donor money on healthcare, that's interesting. Medicine became commercialized and privatized, and inequalities became more unequal because, again, as I said, anytime you privatize something that is necessary to survive, it becomes parasitic and insidious in nature, and more so on an already vulnerable population. Yikes. It's worse and worse. Lack of infrastructure. This could be. This is one of the most resolvable issues, but still a problem. Outflow of doctors to the US because, yeah, we'll give you lots of money to deny people care. It's terrible. Only 6 African countries spend 15% of their budgets on healthcare, and these are yet to achieve universal access to reasonable quality healthcare. So Africa is suffering. That is an entirely different subject altogether. One that I would very much so love to touch upon. But what I will say before transitioning to the next stage of our little stream here is that Africa is literally the world's resource gold mine and is being pillaged and plundered by every other country in the world for its resources to put towards their economies, while literally leaving Africa with nothing. So all of these problems exist because of the exploitation, cruelty, and corruption of Western powers. Now, that isn't to say that Russia and China don't have some influence or involvement in that, but predominantly it's Western imperialism and Western colonialism. And I believe that's the end of the article. So, as we can see, there are good healthcare systems and there are bad healthcare systems, and America is among the worst, in my opinion, not because of the quality of care, but the accessibility to care. It doesn't matter that we can, for the sake of argument, cure and treat anything under the sun, and we invent new practices and procedures every single day, and we have the best pharmaceuticals on the planet. If the regular people can't gain access to it, it's worthless. As we can see in Africa, you can have a universal healthcare system, you can have publicly funded healthcare systems, but if you don't have personnel and if you don't have resources, people suffer. And therefore, having a system, having the resources, but denying accessibility makes it the worst. And with that, we're gonna transition into gaming, where we listen to commentary, more of like a news type deal. And I'll just react and comment on those videos as we play, kind of wind down from the education hour, if you will. And then we'll, after that, watch some creators like Hasan, Vosh, Destiny, and their opinions on healthcare and where or if we align on those issues. So, We will be right back. All right, I just wanted to make sure that I had everything set up already. So it does seem to be the case. So what we should do is hit play.
Healthcare spending is rising around the world.
Well, I guess before we do that, we're going to be playing Final Fantasy 14. We'll just, we'll do some dungeons, some dailies, some, what have you. Ooh. I can start leveling some DPS. Perfect. We'll just do some dailies, listen to what we, can, and go from there.
Back as we've been measuring this, healthcare spending has always risen.
Overall spending on healthcare has doubled over the past 2 decades, reaching $8.5 trillion in 2019, which...
Wow. I was not aware of that. I guess I was a bit mistaken there with that 4.5 trillion. Wow. $8.5 trillion is what the US spent in 2019 on healthcare. And I know for a fact I did not have accessibility to go to the hospital. Not as freely as I would have liked. What about you? Were you able to go? That $8.5 trillion, were you part of that? Were you able to go to the hospital and get treated? Yikes. We just started this segment and yikes.
Comes out to 9.8% of global GDP.
The US spends about twice as much on healthcare than other large and wealthy countries do.
The U.S. healthcare system is not as effective when it comes to controlling costs compared to systems in other countries.
The way the system is structured now, it is cure-driven system, not prevention-driven system.
So there is not one access model here in the United States. And so for preventive services, for treatment, it really depends on people's insurance status, where they're located, and the provider network near them.
It is extremely frustrating for not just patients, but physicians also.
The way we do it, by definition, makes things much more expensive for the US.
So why are U.S. healthcare costs rising more than anywhere else? And can it be stopped?
So, in the first minute and 14 seconds, pretty much they said it much more succinctly than I did, obviously, in that past hour. But that's the truth. That is the absolute truth. We are the most expensive. It is rising. It's, I guess, less of the GDP now, which, fine, but $8.5 trillion is larger than every other country in the world's total GDP, minus, I think, China. I don't know how many countries actually have a GDP. How many countries have a GDP above 8.5 trillion? I can't imagine it's many. List of countries nominal. I just wanted the list. All right. So, according to Worldometer, as of 2023, as of 2022, there are only two countries in the world with a GDP above 8.5 trillion. They are China and the United States. The number 3, Japan at 4.2 trillion. So we are spending, the United States of America is spending more per year in just healthcare costs than Japan and Germany put together. Germany is at 4.07 trillion. That's insane. One country is spending more than two countries' complete total GDP put together in just healthcare, and it is worth significantly less effective, significantly less efficient. That is insane.
Healthcare spending made up 5% of total U.S. GDP in 1960. In 2020, spending hit almost 20% of total GDP.
To be fair, that
so
was
what that
COVID.
means is that for every dollar that people spend in the U.S., about 20 cents is going towards healthcare.
This rise in
See, I need to get better at doing those little sound bites, don't I? Especially if I want to be an elected official one day for you guys. $1 that you spend, 20 cents of that dollar goes to healthcare expenses in this country. Let me ask you something. Let's see. Bottle of water, right? Typically like $1. At Planet Fitness, it's $2. You spend $2 at Planet Fitness to get your water bottle. You have given 40 cents towards the healthcare costs in this country. 40 cents of that water bottle, 20% of this water bottle went to healthcare. And you and I cannot go to a hospital and just be like, I have problems. Please check me out. No. You can go to a hospital. I have problems. Please check me out. And then give them hundreds, if not thousands of dollars. Even though 20 cents of every dollar that you spend goes to that very same healthcare, hospital, provider service. That is an insane statistic. That is insane. Not as insane as the DPS that I'm about to pull off, though.
spending can't be attributed to inflation alone.
Healthcare almost always outpaces inflation, and so, healthcare costs grows faster than the economy. That's why it's representing a larger and larger share of the economy.
The United States spends more per person on healthcare than other high-income countries, but still has a lower life expectancy.
We have poor outcomes relative to other countries. We pay twice as much as any other country. We pay more and get less.
We see that people in the US use a similar amount of healthcare to people in other wealthy and large countries, but we pay more for each interaction. The money's in hospitals and doctors. That's what makes up the big difference between what we spend on healthcare in the US and what other countries spend.
Hospitals, physicians, and clinical care made up more than half of total healthcare spending in 2019.
When we talk about ways to reduce spending, you can either look at ways to reduce the amount of care that people are getting or to reduce the price that.
So, I don't remember what her name was. I don't know if it showed it on the blurb, but this specialist here said there's two ways to address the cost of care. Reducing the amount of care provided or the cost. That is dystopian as it gets. That could be a horror story in one sentence.
People are paying for their care. And in the US, it seems that there needs to be more of a focus on the prices of care, because that's where the real difference is between what we spend in the US and what other people spend in other countries.
Drivers of the rise in healthcare spending has focused mostly on the symptoms of the rising healthcare spending. So when we are talking about hospitals, prices are very high, or drug prices as very high. These are not the causes of the high spending. These are the symptoms of high spending.
One of the causes of high spending is the fragmented nature of the U.S. system. Some Americans have incredibly comprehensive and affordable health insurance coverage, while others have little to no coverage.
For some people, they might spend a very small share of their income on healthcare, and that's usually because they're healthier. People who are sicker will spend a very large share of their income on healthcare, especially if they're in private insurance coverage with a high deductible plan.
Over 11% of the U.S. population was uninsured in 2020, with a large disparity when it comes to race.
Now, again, wow, so they're pulling in that as well, which is valid and necessary, but 11% of Americans were not insured despite spending $8.5 trillion in overall healthcare expenses in these United States. So we're spending $8.5 trillion, and 11% of the 330 million people in this country still didn't have care. That's disgusting, and of course the disparity of how it impacts minority groups is even worse.
51% of Americans said they have delayed or skipped medical care due to cost. That number jumps to 63% among those living in a household with an income of less than $40,000 per year. Even those covered by insurance say they've experienced financial trouble. About 46% of insured adults reported difficulty affording out-of-pocket medical costs. The WHO argues in a 2021 report that...
And again, all of those statistics, all of those hard facts, irrefutable facts, are knowing that we spent $8.5 trillion on healthcare. And that is still the case. That is still the problem. That we are still struggling to pay for it and to have access to our care, and that being poor or a minority means that you still have significantly less access to that care. That is absurd. It's criminal. I mean, I don't know how else to truly even describe it other than by saying that it's criminal. Because what else would you call that? You're spending $8.5 trillion as a country. You're denying healthcare or making it less accessible to minorities and the poor. And it's not even effective half the time because it's getting denied. And those who are finally able to get the care, those few people, are still suffering through financial stress. That is absurd.
Universal coverage would limit catastrophic health spending. This lack of universal coverage can make costs rise while also leading to worse healthcare outcomes, specifically when it comes to preventative care.
When costs become prohibitive for patients to seek care is that, number one, preventative care and preventing diseases from getting worse is always going to cost less. And the cost meaning to the overall system is always going to cost less.
Let's say somebody has no insurance or very little insurance, and she feels a vague pain on the right side of her abdomen. You know, it would cost her $120 to go to the doctor. She's not going to do that. She's going to work through it. And 3 months later, she's in the emergency room, first appendix. It costs $60,000. And we'll treat it. We'll treat her. But if she could have gone to the doctor when she felt that first pain, the doc could have treated the infection. It would have cost $100.
And that's the crux. $8.5 trillion. $8.5 trillion that we spend as a nation, out of pocket, taxes, the whole 9 yards. And we can't even use that care because if we did, we wouldn't be able to afford the out of pocket. So we wait and wait and wait until it becomes an actual problem, and then it becomes even worse. This is tragic.
There is a phenomenon in healthcare called the cost shifting. Cost shifting happens when healthcare organizations shift the cost of those who cannot pay the bill to others who are covered by insurance providers by increasing the prices somehow.
We also have to take into consideration the concept that, you know, maybe 30% of these bills will go unpaid, which can be thousands of dollars. So at some point, if you want to keep your practice afloat, those have to be recouped in a different way.
This is a factor of the U.S. healthcare system where like how much people end up paying is going to depend on your insurance.
A lack of universal coverage and a fragmented healthcare.
Well, this whole oh, we have to recoup our costs. I don't give it. Oops. Did we miss where we were?
Say they've experienced financial trouble. About
I think happens when healthcare organizations
Crap, I
shift
don't know
the
where we were.
cost of
Sorry.
those.
I have my scenes tied to the same button layout apparently, and I misclicked. My apologies.
Who cannot pay the bill to others who are covered by insurance providers by increasing the prices somehow.
We also have to take into consideration the concept that, maybe 30% of these bills will go unpaid, which can be thousands.
There we are. So I was pretty good at guessing where we were. Those bills not being paid is garbage. That is the most garbage excuse, and maybe I'm jumping down her throat too soon. Maybe she's about to express a different sentiment. But unpaid bills is the thing I care about the least when it comes to our healthcare. Because it's already predatory and it's already parasitic, so screw you, you don't deserve my money. I shouldn't have to be paying you additional money to get the healthcare service that I'm already paying in taxes because you want to gatekeep it by creating a parasitic liaison through the form of health insurance companies so that you can justify raising your prices, i.e. price gouging, and extorting the patient in the first place. So that argument is going to do nothing but aggravate.
Of dollars. So at some point, if you want to keep your practice afloat, those have to be recouped in a different way.
This is a factor of the US healthcare system where how much people end up paying is going to depend on your insurance.
A lack of universal coverage and a fragmented healthcare system also mean that people don't have the same insurer for their whole lives, which means that insurers have less of an incentive to provide preventive services or to ensure that you don't get sick later.
I don't know if it's tearing as
Markets
much
move fast, and now
in
you
the stream
can too, with instant
as
funding
it
and
is
fast trade execution at
on
IG.
my monitor
I
here.
chose
Like, my
Wix
game's
for
playing
my
fine. I have
business
a
because of its
RTX
massive scope
3090,
for
but
functionality and freedom.
this
of
would be extremely
creation.
difficult to watch if this
Being
is
able
what you're
to
seeing.
integrate and change and develop at my own pace. I offer a range of products and services. To manage it all from one place is essential. It gave me time
Why
back in
don't
my
I
day
just-
to get going on actual projects. It really just made everything feel more achievable.
Standard desktop?
The majority
There
of
we go.
Americans don't have much of a choice when it comes to their insurance plan. More than 54% get health
less
insurance through their
chaotic.
employer.
Capitalist view works when the market is free. Healthcare is never a free market.
Instead, we have insurance companies bidding on patients' behalf, which limits patients' ability to.
Companies called
So again, bargaining, right? We're using terms that are capitalist, that are for profit, that are business. There should be no bargaining. There should be no debating. There should be no competition to get healthcare. There should be, hi, I am sick. I have cancer. I have a broken leg. I have a hangnail. I have a runny nose. I'd like to see the doctor or the nurse now. That is all the more that we should be discussing. And it is abhorrent that we're talking about such things as competing for patients and things like that. That's disgusting. Not at all what we should be having to talk about in a healthcare system that spends $8.5 trillion on a 330 million person population, which you would think would be able to provide access to that entire 330 million population.
their own networks where they dictate which doctors you can go to.
Patients also can't bargain because they usually don't know how much care actually costs.
One key requirement.
Because it's hidden, which is the other thing. There's no oversight. That's the worst part. I say worst. It's pick whichever horrific aspect of our healthcare system is worse, I guess. But the fact that it isn't transparent is another problem, which is again why the multiplier, you actually have to dig real deep to figure that out. And there was a study that was done in 2011, which is obviously no longer accurate because that was over a decade ago, that had a snapshot in time, the cost of care and the multipliers involved of that care at facilities all across the country. And at the time, it was on average 3.5. But in places like Los Angeles, it was up to 10 times. 10x!
In a free market is to be informed about the price of the product or good you are purchasing. But in healthcare, patients are in the dark about what would the cost be when they seek their care.
Insurance makes prices even more opaque, not just for patients, but also for doctors.
Sometimes it is difficult to know upfront what a patient's costs are going to be for whatever services that they're getting. At the end of the day, we are actually not the ones controlling the rate for each different company. And even if we have a whole list of every single possible charge, we don't know if people have met their deductibles yet. We don't know where they are with respect to out-of-pocket maximums. We don't know, what their copay might exactly be, if it's a percentage.
A lot of care is delivered through what's called fee-for-service. That means for every service that your doctor delivers to you, that doctor is billing for each individual thing. And that can create an incentive called provider-induced demand, which is basically that your doctor has an incentive to do more things to you.
But it's more complicated than just greed. America's litigious culture can play a role in
if you're not laughing, you're crying, right? They straight up said, aside from greed being a major problem in the U.S. healthcare system,
excessive testing.
I do think that in the United States, we do order more tests simply because, one, there's this fear of missing something. Of course, that comes from a human aspect where you don't ever want to misdiagnose a patient. But then there's also the malpractice side of things, where if you do miss something, what are the consequences?
Since there isn't true free market competition, insurance companies will try to rein in the spending by either denying claims or requiring pre-authorization.
Most physicians are doing the right thing and choosing the right treatments for their patients. But sometimes there are instances where the procedure that's being requested may not always be the most effective treatment for that particular patient. And sometimes the prior auth process also serves as kind of a gatekeeper, so to speak, of whether that physician has tried everything that could potentially help the patient.
Which goes back to that cancer example that I was giving. You have cancer. You were diagnosed with cancer. And then the insurance company's like, well, have you tried losing weight? Have you tried dieting? Have you tried exercise? It's like, you're not a doctor. You don't know anything about cancer. They do. And those things that you just mentioned, dieting, exercise, I don't know, going out in the sunshine or something, have zero things to do with cancer. Cancer is an anomaly of the cells that are growing out of control and taking up your blood and resources and everything else. That's what cancer is, a very watered down explanation.
There are proponents for completely overhauling the heavily commercialized system.
You have to make the commitment to provide health care for everybody. That's the destination. It turns out there are many different routes to that destination.
One of the more popular policy proposals is Medicare for All, which would replace for-profit insurance companies with government-funded health insurance.
I am a strong supporter of Medicare for All because it is our principal goal in this country to give everyone coverage at the lowest possible cost, and Medicare is the best way to do that.
So that statement isn't incorrect. It is, however, disregarding what an actual universal healthcare system would do, which is regulate the cost, reducing it outright, and allowing it to be a better version of the funding rather than it being some sort of insurance. The separation between healthcare, accessibility and funding and all of that, and the patient is the problem. If you add more steps to that, you increase the amount of bureaucracy, i.e. the cost, and the efficacy of being able to communicate between those things.
Joe Biden is instead focusing on expanding the Affordable Care Act to enable more people to get insurance. There's also been a bipartisan push for increased price transparency. Congress passed the No Surprises Act, which went into effect in January 2022. The goal of the legislation is to help Americans avoid surprise medical bills.
Now people who inadvertently go to an out-of-network provider, for example, by going to an in-network hospital but being seen by an out-of-network doctor, that patient is held harmless. And then it's up to the insurance company and the doctor to kind of work out how much it gets paid to them.
Researchers and economists are still debating what exactly is driving these costs in the U.S.
It's very hard for people to know how much healthcare is going to cost them before they get it. Some of that can be addressed through price transparency efforts by basically posting prices on hospital or doctor
and universality of those
Research
prices
has to be intensified in this area to clearly identify the root causes of the high spending and the interrelationship between the different routes.
There's a lot of moving pieces here, and there's probably not going to be one single solution to healthcare costs and access and quality of care and insurance coverage, but there's a lot of different directions that policy is starting to go in terms of actually addressing the healthcare costs in the U.S.
That was an
Funding for
overwhelmingly
this program is provided by
depressing
contributions to your
synopsis of U.S. healthcare. Accurate, but also depressing because it was accurate. I can't get over that. $8.5 trillion is what we spend as a country, as a population, on healthcare. And the overwhelming majority of us can't even get access to that care without going into debt. Assuming we even get approved for that healthcare in the first place, which is insane. Just every part of that is abysmal. Now, I do realize I need to come up with another video here, so can I go hit back? That's how that works. I can't read that from here. So 1 second. I want to participate in this fight here. So this is Final Fantasy XIV. I'm playing a Dragoon. And this is just one of our daily roulettes in a raid. This is one of the the Ridorana Lighthouse, which has elements of both Final Fantasy XII and Final Fantasy Tactics in the storyline and bosses that you fight. So all of the bosses in these level 70 raids are actually from Final Fantasy Tactics, Construct 7 being a playable character. Calibrate vials to 3. See, I wonder though, does that... Oh, okay. So, by the way, in this particular fight, it's your HP number that you have to look into. So if at 9, you need to be at 3. For this case. Oh, and now at 5. Now I don't know what I'm supposed to do. Dang. That's weird. Maybe you're supposed to add yourself. Like, if your number was 6, you need to add it to the 4 for the 5 or whatever it was. Anywho, the bosses here are from Final Fantasy Tactics, every single one of them. So in the other Orban Monastery, when you fight Sidolphus and Agrias and Meliodas, or Matthias? Now I'm forgetting the name. Those are all playable characters in Final Fantasy Tactics, but you're being led by Fran, which is one of the main characters in Final Fantasy XII. Which is one of the reasons why I like these raids the most, is because of nostalgia. One of my favorite Final Fantasies is Tactics. I would add 12 to that list, except that the storyline is extremely, extremely short. And most of the in-depth that you get out of it is from all of the side questing. Whereas with Final Fantasy, I feel like you do get a lot more story out of it. And then Tactics, of course, is just... I don't know how else to describe it. I think if I had to do favorites, it probably would be Tactics is number 1 and 7 is number 2. In terms of favorite, because it just has... Tactics has so much story, so much depth. Everything about it, between the story, the music, the composition, the feel, just the drama of it all. It's like your quintessential RPG, you know. It's just what you think an RPG should be, and it just constantly delivers. So, oh, better run out of there. Now, again with the Dragoon melee class, lots of buttons to press, lots of cooldowns that are part of the rotation. I don't claim to know the rotation correctly, as I am returning to this game after literally years of not having played it. My little flower that you get, this little yellow flower, which, let's see if there's one around here. Yeah, this guy. See this little flower right there? That's a returning player, and mine disappeared after about a week, I guess. Or 2, maybe. And I feel bad for everybody who thinks I know what I'm doing. Because I most certainly do not at this stage of my Final Fantasy XIV career. Although I am hoping to get very familiar with all the classes again, and perhaps get involved in high-end raids. I think that would make for very interesting content. Specified rhymes. Well, 8 plus 3 is 11. So that's gotta be it, right? Yeah, okay. So it's whatever your little number is, and then you have to add. Oh, okay. So now it's multiples of 3. 8 plus 1 is 9. Wait, why did I get hurt? Oh, probably because somebody messed up. It's all good. It wasn't me that time. Alright, so we're almost done here with construct number 7, and then I'll find us another video. Alright. Cannot read any of that. Okay, so this is what we're gonna do. I'm just gonna go to Googly and find out what do we got going on here. It's the one we just watched. Let's see if Vox has a better insight. Or a different insight, rather.
Help me!
Alright, we can skip this ad now.
I cannot tell you how obsessed I am with this chart. It shows exactly what is wrong with America's conversation about healthcare. On one level, you've seen this chart before. It shows healthcare spending as a share of the economy of a bunch of countries. There's Germany and France and Japan and Canada, and oh, there's America. But now I want to add something you haven't seen to this chart. This is how much of that spending in each country is private and how much is public. Here's what's amazing. America's government spending on healthcare, on programs like Medicaid and Medicare and the VA, our versions of socialized medicine, it's about the same size as these other countries. These countries where the government runs the whole healthcare system. And then there's our private spending. It's the private insurance system that makes healthcare in America so expensive.
Oh, okay, here we go.
Conventional wisdom says that the government is more expensive than the private sector. It can't say no, it's corrupt, it's inefficient, it's slow. You want something done right, you give it to the private sector. That is what we hear in America all the time. And yet here we are with the biggest private sector.
It is unequivocally false.
Why is the free market so bad at controlling the cost of healthcare in the United States?
Because it is incentivized to not.
If you look at the data on physician visits and hospital discharges, you can get rid of one thing. Americans don't consume more healthcare than people in these other countries. We don't go to the doctor more than the Germans and the Japanese. In fact, we go to the doctor less. The difference between us and them is that we pay more. Every time we go to the doctor, for everything from a angioplasty to a hip replacement, from a C-section to a pain reliever, In America, the price for the same procedure at the same hospital, it varies enormously depending on who is footing the bill. The price for someone with public insurance, like Medicare or Medicaid, is often the lowest price. These groups, they cover so many people that the government could demand lower prices from hospitals and doctors, and they get those lower prices. If the doctors and hospitals say no, they lose a ton of business. They lose all those people on Medicare, all those people on Medicaid. But there are hundreds of private insurance companies, and they each cover far fewer people than a Medicare or a Medicaid. And each one has to negotiate prices with hospitals and doctors on their own. And if you're uninsured, you have even less leverage. Nobody is negotiating on your behalf. So you end up paying the highest price. One study found that most hospitals charge uninsured patients 4 times as much as Medicare patients for an ER visit. Other countries, they don't have this problem. Instead of every private insurance company negotiating with every healthcare provider, there's just this big list. Country, the central government, they go and they say, if you want to sell to us, to all of our people, then here's what you can charge for a checkup. Here's what you can charge for an MRI or a prescription for Lipitor. And so then whether that bill goes to the heavily regulated private insurance companies in Germany or directly to the government like in the UK, each country is telling the doctor or hospital or drug company how much that bill will be. And because the government controls access to all of the customers, it's an offer that hospitals and doctors and pharmaceutical companies typically can't refuse.
Now, I let that play a lot because we've already addressed many of the issues that he described, right? We talked about the cost of care. We talked about that Americans use it less because it's expensive, and there's really almost no point. And the fact that that's one of the biggest issues with our healthcare system is that nobody can really even afford to use it, so it doesn't matter that it's the best in the world. This kind of hits home the point that other countries dictate to the companies while having that slight element of, privatization and commercialization. They're still dictating the terms, right? The government and those countries are still saying, at the end of the day, you have to charge no more than this, which of course usually translates to then we will not charge any less than that. But it's still being much more regulated and controlled, which is significantly better than what's happening in America.
I'm going to make him an offer he can't refuse.
In America, the idea is that you'll be a consumer, that you'll do what you do when you go to Best Buy and buy a television. But that just doesn't work in healthcare. It doesn't work in healthcare because you often come and get healthcare when you're unconscious in an ambulance, when you're scared, when it's for your spouse or your child. It is a time when you have the least bargaining power. You are not usually capable of saying no. You're not knowledgeable enough to do it, you're not comfortable doing it, or you're not conscious enough to do it. That's why in other countries, the government is a person who can say no for you, who can say, no, that's too expensive, you're gonna have to lower your price, because they do have that power.
And by the way, a universal healthcare system would mitigate the need for a government to say no in the first place, because it wouldn't matter. Because the price would be the price. There is no negotiation. The price has already been allocated and paid for by tax dollars, meaning there is no out-of-pocket expense. You go to the doctor, you get treated, you go home. That is the key difference between universal healthcare systems and anything else that would be hybrid or not.
A new push for single-payer healthcare right here in the U.S.
California and others are saying maybe we should adopt the European model.
If we decided to create a single-payer system with one of these huge price lists in the U.S., there'd be nothing to stop lobbying from hospitals, from doctors, from drug companies, and those prices would get influenced. So we could end up with a single-payer system that is expensive, even as expensive as our current system. It all depends on how much you negotiate down the prices. And now in America, these groups have so much power because they are so rich that it's really hard to get them to bring down the prices. This is the irony of American healthcare. It's so expensive that it's become hard to make it cheaper. All that money they...
Wrong. It is not hard to make it cheaper. You want to know how you stop lobbying? Making lobbying illegal. You want to know how you stop making these companies be rich? Federal regulation. Literally, you want to curb their power? We could literally federalize the entire medical industry. And we could make pharmaceuticals and hospitals publicly owned and part of the public domain. These are non-arguments. These are cop-outs. And I will not tolerate that nonsense. If we can write a law into existence that is harmful and insufficient to our needs, we can certainly write a law that is. And that's the difference. So
they make, that becomes political power. And years and years and years of overpaying, those are huge industries now. And they have a lot of influence in Congress. Under a single-payer system, if we did drive prices down, doctors and hospitals, they would be paid less than they are right now. That might mean some of them close, or some go out of business, or some move. It would be really painful. One person's waste is another person's essential service, or local hospital, or their income. But then single-payer, it's not an all-or-nothing choice. For instance, there's a really interesting section of Bernie Sanders' Medicare for All bill, where he lays out this interim plan. It's a plan he wants while he's setting up his new single-payer system. And in that plan, he expands Medicare to cover vision and dental, and he opens...
See? Yeah. Not trying to toot my own horn, but I do know what I'm talking about when it comes to policy. Medicare does not cover anything that isn't medical, and therefore universal healthcare as a Medicare for all as a substitute for universal healthcare is vastly inefficient.
It to nearly everyone, not just people 65 and older. All kids go on Medicare automatically, and most adults can buy in. That plan on its own, it wouldn't get American healthcare spending far down overnight, but it would at least begin to recognize what we already know, and what most other countries already do, that healthcare is one of those things that government can do cheaper and better than the private sector.
Well, okay. I am trying to be very consistent with the stream and its what do you call it? The way we are partitioning the time. So with that, we are getting to the commentating, where we listen to other creators. We take their takes on their opinions on the subject of the day, which is healthcare, and whether or not I agree, what my opinions are, if I do or don't, and what are their strengths and weaknesses from the perspective of someone who could one day represent you in Congress or in the Oval Office. So without further ado, we'll just go ahead and jump right to that. This is Hasan's take.
Anyway, let's watch. Okay, what do Americans think of socialized medicine?
What do you think about socialized healthcare?
I do not like the idea of that.
Oh my God. Oh my God. Thank God. Brave American right there. Real American. Yeah, if you go to Times Square, you're not going to find an actual New Yorker. You're going to find like every goddamn tourist. They're dumb enough to go to Times Square. Why would you ever listen to their opinion? I'm sorry, dude. If you're stupid enough to go to Times Square, then like, you know, I don't care about your opinion at all. They literally went to a heavily populated area of New York that's mostly populated by, you know, naked cowboys, dudes who are trying to sell you their mixtape, or people who are giving you flyers when you're walking down the street, Applebee's, and ads. Like, you're going to
I mean, he has not mentioned a single thing about healthcare, but is what he's saying true? I personally don't go to New York City very often. I try to avoid it as much as possible because I despise driving in New York City traffic. So I've never really experienced the touristy elements, because if I ever have to drive through there, I just want to get out as quickly as possible. If I'm visiting somebody, I want to visit and then not be in that city. It is an extremely stressful city for me. But I would be very curious to know if Times Square is basically not New Yorkers.
Times Square to see fucking ads, dude. Just put yourself in the mentality of someone who's like, oh yeah, I need to go see the goddamn big ads on the jumbo screen. Like, what the fuck?
If everybody has something for free, who's going to pay for it?
Well, I guess now I'm commenting against the people. Okay, so Ocean, you know for a fact it's mostly tourists. That's fair. I hate this question though. If everything's for free, who's going to pay for it? You would not have to pay anything else in addition to the taxes that you have already paid to go to healthcare. See, when we're talking about free public services, we mean that they are already tax funded, that they are already provided for. And I get it. We might run into a few MMT people one of these days, and we'll have that nice long argument. But fundamentally, our country operates off of the concept of a budget and allocating funds towards certain budget elements. We're currently discussing healthcare. Medicare is part of that healthcare budget. If I have to pay additional money, who's paying for it? You. If you go to the hospital and you have to pay even more money, you're paying for it. Versus if you're already paying it in your taxes through payroll, and then you go to the hospital and you don't have to pay for the money, who paid for it? You, but you're not paying anything else. Do you see how that works? By the way, what's the difference between insurance, which is a collective pool of money paid for by a bunch of other people paying into it so that people can collectively take money out of this pool, and the taxes, where everybody who's working pays a certain amount of taxes out of their paycheck, puts it into this pool of money so that when you go to the hospital, everybody can take money out of that pool to gain access to that healthcare. Except the Medicare cost, the taxes that are taken out are like 1%, if that, of your actual federal taxes, whereas health insurance is usually 10% or more. So who's paying for it? We're already paying for it. You're just paying double and triple and not even getting anything from it. You're just giving a rich person more rich people things.
Okay, what if people pay for it by taxes? What do you think of that?
Well, that's going to increase. You like to pay taxes?
I love my favorite thing, and I've talked about this before. My favorite thing is like when people describe normal things that they simply do not understand. So they talk about it like it's with a skeptical lens, like, you know how I do that like bit about the DMV, like, you mean to tell me I got to go to a government agency and take a photo of myself, put my thumbprint down, and then they give me a piece of paper so I can drive my vehicle that I bought with my hard-earned dollars? You fucking kidding me? Like, it's just like a normal part of the process, but like Republicans can turn that into like something authoritarian if they like talk about it in skeptical terms. And this guy's basically doing that with health insurance, right? Or with healthcare, where he's like, what the fuck? You mean to tell me that like I'm gonna pay into a pool of funds so that I can like take out money if...
Nice. I guess me and Hasan are on the same page. For now. We'll see if that changes.
Eventually, when I desperately need that health care, that sounds fucking crazy. It's like, congratulations, you just described the concept of insurance, and making it into a tax system, putting that into the taxation system, or having the government control that, basically eliminates the fucking middleman and has the largest possible pool. You know, you're just describing insurance. There's a stunning new report that ranks the U.S. dead last in healthcare amongst the richest countries despite spending the most. I mean, this is not a new report. This is like an ongoing thing. The report analyzed 71 healthcare performance measures in 5 categories. Norway, the Netherlands, and Australia were the top performing countries overall, with the U.S. coming in dead last. Last on access to care, administrative efficiency, equity, and healthcare outcomes, despite spending 70% of the GDP on healthcare. There you go. And you pay fucking so much. We pay so much for healthcare. That's the funniest part. Like, we literally pay more for healthcare than anybody else. Oh, speaking of healthcare, by the way, a Texas GOP official died of COVID-19 5 days after posting an anti-vaccine meme on Facebook. His name was H. Scott Apley. He was one of the fucking 3 people that we saw on that list.
I apologize. I shouldn't laugh that somebody died, but I guess this is the part where I say I am trying to separate myself from being a reactionary and a sensationalist streamer, and trying to be more focused on being focused on presenting the facts and providing insights from a different perspective, such as from the legislative side, or as someone who would be debating on the congressional floor or be signing the bill in the Oval Office. But I'm still a person, and I definitely experienced Schadenfreude as much or more than you that may be watching this. And people like that had it coming. And honestly, accountability means a lot of different things to a lot of different people. As far as I'm concerned, that was accountability.
Of 6 people that died of COVID, or 3 of them died of COVID. He was 45 and consistently mocked vaccines and masks on social media. And here's a fun little tweet from 2009 from this guy. Hey, middle class, stop buying houses, cars, and things you can't afford, and you will free up enough money to pay for private health insurance. Help Scott and Melissa Apley, medical and funeral. I guess he should have, stopped buying houses, cars, and things he could not have afford, things he couldn't afford. People always use the argument that the standard healthcare in the U.S. is better because it's all private, not realizing it's ranked 37th best in the world behind loads of socialized healthcare systems. Yes. The thing is, in the United States of America, experimental treatment, like certain experimental treatments, like certain things, and that's why Ben Shapiro always cherry picks this shit, like, I don't know. Most people can't afford to pay for it, so they don't get anything. So when people always say like, well, you know, in fucking, you know, in the UK they ration healthcare, they ration healthcare. It's like, yeah, they ration it by need rather than by who can afford to pay for it. You fucking idiot. It's like saying.
Honestly, I think we can keep playing and reacting to this. I believe all I need to do is. Hello. Oh, that's because I clicked off on it? No. There we go. Gonna work? No? Let's see. I would like to change what we are watching. Oh my goodness. I think I actually closed out that. All right, so copy. And then paste. And instead of that happening,
Anyway, let's watch.
I clearly put it in the wrong one. Guys, I am really bad at on-the-fly editing of streaming stuff. I apologize.
Anyway, let's watch. What do Americans think of socialized medicine?
What do you think about socialized healthcare?
I do not like the idea of that.
Oh my god. Oh my god.
I think we were at like
brain cancer or whatever.
Yeah, brain cancer. That's where we were. And then this doesn't need to be in the middle there. All right.
For the fuck is above and beyond. Okay, it's like one of the best. Like we'll have like some of the best treatments and healthcare facilities. Now, part of that is also rationed off for just rich people. If you can afford to pay for it, yeah, you can get one of the best. But most people can't afford to pay for it, so they don't get anything. So when people always say like, well, you know, in fucking, you know, in the UK they ration healthcare, they ration healthcare. It's like, yeah, they ration it by need rather than by who can afford to pay for it. You fucking idiot.
And I would also, to that point, I would argue less that it's being rationed and more so that people are getting consistent enough care that they don't need all of this emergency specialty stuff that Americans do, who are denied access to this healthcare in the first place because they can't afford to go regularly to get the preventative stuff, and it ends up just ballooning and spiraling out of control until it becomes some of the more expensive and more specialized things. So I think it's less gatekeeping. I would argue semantics at this point than it is necessity. That people in the UK just generally do not need as much healthcare in these extreme cases because they are generally more healthy, because they are generally more able to receive preventative healthcare and be able to, for instance, with the brain cancer. Obviously, if you have brain cancer, that's a terrible thing, but there's a point where it's preventable. There's a point where it is treatable. And if you're going regularly, every 3 months, every month, every 6 months, every year, chances are it's going to come up. Or if you have a headache and you're like, man, and you take some ibuprofen or whatever and it doesn't go away and you're taking more and more and you're like, okay, it's becoming a problem. And you have the ability to go to the doctor, and then the doctor's like, all right, what's the problem? I have headaches, tried ibuprofen, tried sleeping better, cut out caffeine. Never would cut out tea in England, of course. But I still have these terrible headaches. The doctor's like, you know what? All right. Let's just do a MRI, CT scan, what have you. Oh, crap. You have brain cancer, but it's in the early stages. We're going to set you up, hook you up, and get you taken care of. Whereas in America, it's like, man, same scenario. And like, yeah, sorry, we have to ask your insurance provider if we can do preventative care. 3 months goes by, you're at stage 3, and now you have to pay for $100,000 worth of chemo. Significant difference. To Hasan's
It's like saying Turkey has the best healthcare because they have the best, nose plastic surgeons or the best hair transplant surgeries. You know what I mean? If you wanted to say, like, the Turkish healthcare system is the best in the fucking world and point to just that, then yeah, you're correct. It's like saying Korean healthcare is the best because they have the fucking best plastic surgeons in general. Every country has a thing that they're good at. We happen to be good at, like, a couple different cancer treatments. Cuba is better than us with respect to lung cancer, at the very least, because they have a literal fucking lung cancer vaccine. Also a higher life expectancy. We're number 1 when you look at the overall number, but that's because we're a gigantic country. We're a massive country. We have a lot of fucking institutions. And of course, we're going to be number 1 with like new chemical compounds across the board. But we're not number 1 when it comes to the per capita argument, when it comes to like new chemical compound developments. And that's a pharmaceutical argument. Okay. That's an argument about like pharmaceutical research and whatnot. And even then, most of our pharma R&D and drug discovery is government funded. Yes, this is also true. It's really dumb. It's a really silly way, but like dipshits like Steven Crowder, who can afford to pay for whatever treatment that they're getting, like top surgery or whatever the fuck he's doing right now, off of the people that he's
Kefka. Oh my god. This bastard is probably as iconic, if not more iconic, than Sephiroth in the Final Fantasy series. Like, if you know nothing about any of these, you have more than likely heard of at least Kefka. And honestly, let me see if I have... Oh, I don't remember where I put his laugh. But I'm telling you, this guy is probably one of the most successful villains as well, because he actually destroyed the world. Spoiler. Is this it? Is this it? I'd have to look for it. I thought I... Oh, no. Also... Nope. Oh, I just ran off the edge. That's what I get for not paying attention. Don't run off the edge in Final Fantasy XIV because you can 100% die.
Milk by yelling about how fucking American healthcare is great and socialized healthcare would be terrible. I believe in socialized medicine, but doesn't Denmark have super high taxes that people can't afford because of it? I'm sorry if this is a dumb question. I genuinely don't know. What do you mean super high taxes? No. A lot of OECD nations that we rarely ever compare ourselves to have a higher top marginal tax rate, for example, for income and shit like that. But ultimately, what do you mean? They can't afford higher tax rates? Like, it's silly as fuck. It's a silly take. They also have KDV or...
Oh, yay, ads. That's what we want to listen to.
VAT. Like, even then, the higher tax rate is comparable to, like, the United States when it was thriving, or when the middle class was large and growing. Like, I mean, there was a...
So I don't know if he's actually going to say the numbers, but the top marginal tax rate for the United States from the Eisenhower administration until the Reagan administration was a range between 93% and 70%. During the Reagan administration, it was slashed from 70% to 38%, I believe it was. So what he's saying is absolutely true. Not only have the rich been paying more taxes in the past, and we survived as a country, we also thrived. And it was during that time that we also had the establishment and the true beginnings of the middle class in the first place. It's when we built our interstate highway system. It's when we built our international railway system. It's when our international air system was established. It's when unions were the strongest. It's when Pennsylvania steel was globally renowned for its quality and strength. So to say that we can't tax the rich more, or that we couldn't expand the current taxation of Medicare and what have you to be uncapped because it would somehow detrimentally impact the economy is patently false.
A period in time when in the United States of America, the top marginal tax rate was literally fucking 90%, dude. Our healthcare being tied to our place in the workforce, another thing corporate entities can hold us, keep working. Yes, that is deliberate. It's by design. Just like college debt, student loan debt is created in a way by design to force masses that go to fucking college to go and take on jobs, no matter what their situation, no matter what their circumstances are, because they're desperate to pay off their fucking loans. Same with like employer.
I would disagree on that reasoning. The education system being for-profit is a completely different problem. It's a class gateway, and as we are seeing with these current student protests, colleges and universities are essentially just banks to launder money into the military-industrial complex. So that is different. Indebting students is the class gateway. If mommy and daddy are paying for your student loans in the first place because they make $500,000 together, versus, Snuffy, who is paying out of pocket, doesn't have a scholarship, mommy and daddy can't afford it, or they don't have a GI Bill to share around, those are the people who are going to be desperately burdened and saddled with that debt. The other problem is less so the debt and the issues there, although it's still a problem, is the fact that employers are completely disregarding those degrees in the first place and not charging accordingly. They're not providing wages commensurate to a educated degree holder. If you are a teacher at a public school and you're getting paid $40,000 a year, but you have a master's in education, that's not professional level wages. That's the bigger problem. Aside from the predatory nature of student loans in the first place, which are the one thing that can't be removed from bankruptcy or any other means of avoiding debt or paying off debt that we have access to.
Backed healthcare. If your healthcare is tied to your employment, then you're not going to want to rock the boat. I mean, even someone like myself experienced this when I made that fucking big leap to Twitch. It was the greatest thing I've ever done. When I left TYT, I left behind my fucking healthcare. And that was a terrifying prospect for someone, especially because like that was the main motivator for me staying at fucking the Young Turks. Because I was like, I'm terrified. What if I can't fucking, what if Twitch doesn't work out? What if I get banned? Some countries have similar comparable systems as well, by the way, with respect to like the German system, for example. The German insurance industry is literally by design not for profit for all of the important healthcare necessities. Most of the healthcare systems that you look at, like, yes, there are tweaks, there are differences. None is as common.
So I can speak to the German healthcare system because I was a foreign exchange student in Germany and I broke my toe ice skating. And when I went to the doctor, I was like, I'm an American. I'm here on foreign exchange. I'm not a part of the system here. How much is this going to cost me? And they're like, are you stupid? It's not costing you anything. But then they heard the American part and they're like, okay, I get it. You're broken. But yeah, buddy, we're going to fix you up. And then we're going to tell you to not do whatever it was you did. And, okay, so I do have a cough guy. And go from there. So that is 100% true.
Comprehensive as like the UK's NHS, obviously. It's the greatest, in my opinion. It is the healthcare system that everyone should strive towards. It's what we should be moving towards all the time, completely eradicating profit from healthcare and pharmaceutical in its entirety.
100%.
Yeah, Wendell Potter is one of my favorite people. Former vice president of Cigna said the U.S. health insurance companies lobby the government to spread misinformation about universal healthcare. Yes, we know that already. He did it himself personally when he was the VP at Cigna. Wendell Potter is awesome. He's an insurance industry executive who is a big Medicare for all defender and advocate. But that's the big reason they constantly vilify any sort of effort towards socialization. And that's the problem. But yeah, this is a sad, pathetic fucking thing to find out, but it's just the reality. If you're watching this, welcome. Isn't the U.S. too large for centralized healthcare? Just honestly curious. No, because one, economy scale, right? So as far as the size of the United States healthcare system, you can absolutely have a fucking massive healthcare system. You can absolutely have a massive healthcare system.
And we do. We spend $8.5 trillion or more on our healthcare system. And that is ludicrously massive. It is more. $8.5 trillion is literally more than the combined GDP of Japan and Germany. Combined, they are at 8.2 trillion. So what we spend in healthcare alone is their entire country's gross domestic product. The accumulation of their industry, of their business, of everything. We spend more than that put together in healthcare alone. And that's, I don't think that's a concept that most people can really wrap their heads around.
Because we have more money, we have more people, we have more doctors, we have more money, we have more institutions. Like, we can do it. We're the richest country in the world, too.
What do you think the average copay is under the NHS?
I can't imagine it goes any lower than 30.
The amount for me is like $120.
Yo, lady, you have dog shit insurance, dude. But this fucking dumbass lady literally was like advocating against socialized medicine. Like, why would I do socialized medicine? That's terrible. I don't want the government touching that. And then she's like literally paying $120 for a copay. Like, what are her fucking premiums? You know what I mean? God, what a fucking idiot.
My family physician.
And so based on.
So you got sick when you were in Norway and were technically a tourist at the time. And you had to pay $30 for an ER visit and meds. You were in and out of the ER in 30 minutes because they let you schedule the visit since it wasn't a huge emergency. I mean, case in point, universal healthcare, right? Well, if we have universal healthcare, then all them immigrants are going to come on down to America and take our rights and our services that we done did pay for with our damn tax dollars. So what? I'm trying to not say certain words, but I think it's valid. So fucking what? Who cares? If we can spend $8.5 trillion on healthcare and it be truly universal, and we have a fully funded, fully staffed, fully fleshed out, kitted out, equipped, taken care of hospital system and network throughout every part of our country, and nobody has to pay out of pocket, come on down. Healthcare tourism. America has been number one in the world for only a few things in the past few decades. Prison population, cost of care, and I believe there was another thing that was basically dystopian. Police budgets. Those are the things that we are the number one of. Prison population, police budgets, and cost of care. If we actually had the best healthcare system, the best education system, the best mass transit system, the best jobs and wage and workers' rights system, we would have a significant influx of immigration, more so than anything we've ever done before. And guess what? We could create infrastructure to accommodate that as well. If we can be the best in the world in healthcare and it would benefit Africa, Latin America, I would happily pass laws to facilitate them coming in, getting the care that they need, and being able to go back home. That is something we should be striving to do as a leader, not trying to dismiss because we don't want the other in our country.
Now, what would you guess would be the price there?
I would say probably higher.
Higher?
Mm-hmm.
It's actually, there isn't a copay, so it's $0. What about specialized costs, or specialized care, like an inhaler or an EpiPen?
And I'm just guessing, at the most $20. I would say it's probably higher.
Okay, it's actually £9.
Just 9.
For any medication, which is about $12.
Okay, so they are cheap.
What do you think of that?
I am still for individual.
Bro, what did she get? Did she get one of those January 6th insurrection Capitol riot shirts or something? What's she wearing? That was cheaper. Yeah, I still want to pay more. Dumbass. I want the freedom to pay more.
Have you ever?
So, I thought he was going to bring up a different point, which is, how do I want to phrase it without coming off too disparaging? There is a lot of misinformation, propaganda, and lies that we have to peel back from the general population so that those reactions aren't the knee-jerk reaction, right? Because we have been conditioned as a country to reject these things. Hey, thank you for the follow. And that's the problem, right? That was a canned response that she was conditioned to give, because in America, it's like, well, I'd rather have my freedom and my private rights to have access to my care and my choice rather than have it be dictated to me by the government. And unfortunately, that is true for a lot of systems, whether it's healthcare, whether it's education, whether it is labor rights, or even talking about unions. I don't like unions because I have to pay them dues and they don't do me any good. They don't help me. They're just there out for themselves, because what is in reality the case is that workplaces and institutions dictate so much of the reality of the worker that's what they think a union is. Am I the only one who thinks that the all eyes on Rafah Instagram stories are worthless and they don't do anything to fix the problem? I don't want to answer that in a disparaging way. I don't think they are useless, but I do agree that that is not how to fix the problem. I will tell you what the intent of those are. If right now in the news, especially in Western news, in America especially, there is very little coverage of Palestine, and what little coverage there is of Palestine does not focus on the humanitarian crises. It focuses on, Israel, and how October 7th was the only time ever that anything ever happened in the Gaza Strip. And because of that, there is this misconception that October 7th was an isolated event, that Hamas is a terrorist organization, that Palestinians have been terrorizing Israel, and so on and so forth. And so what these All Eyes on Rafah are trying to accomplish is, hey, what's happening in Rafah right now should concern you, because it's genocide and ethnic cleansing, it's apartheid, it's all these other things. And so it's trying to build awareness. Yes. Are they effective at resolving the issue? No. They couldn't be. There's no way an Instagram post that says, look at these murdered children, these people who were burned alive, these people who are suffering atrocities and horrors beyond our imagination, look at this, is going to accomplish a single goal. What a lot of those Instagram reels are missing, and would infinitely make them more effective at creating social change or policy change at that, would be a call to action where you contact your congressman with a phone line or a website that is contact my rep. So obviously I'm in the middle of this fight here, but what I did in my stream yesterday was highlight that exact purpose. I went on Google and I typed in contact my representative, and the first 10 lists were different organizations with different APIs where you could type in your address and you would find out who your representative is. So in my opinion, if you're going to do an All Eyes on Rafah or a Palestine video of some sort, I don't know why I just died, then what you need to do is have the call to action to contact your representatives. Now, when I say representatives, I don't just mean Congress or Senate or the president. I also mean your governor. I also mean your state representative. I also mean your state senator. Why? Why would you contact your state representatives about a federal, national, international issue? Because state governments are also a part of this conversation. They are the ones who are able to dictate the funding and the supply of the military-industrial complex that is facilitating these activities. Yowza. Can I heal myself? And therefore, if you don't have those call to actions and you're not utilizing all of the resources at your disposal, all you're doing is shaking your fist. It's another criticism I have about protests. If all you're going to do is go to protests and shake your fist and shout and get your adrenaline rushing and your heart pounding and your blood, hot and heavy, then all you're doing is performing a play, an act in a play. if you're not making demands, if you're not showcasing it, if you're not streaming to an elected person's page, if you're not, demanding an action and a response, then you're not protesting. You're just yelling into the void, which is your right. That's still a protected First Amendment right. It's just a waste of time, and it is not effective. So I hope that answers that question. I think it's important to spread awareness, but it is just as important to ensure that information is shared that is actionable and that can actually engage with the people who are making these decisions and encourage them to make the right decisions.
Not sought treatment because you're afraid of a cost?
No, ma'am.
Do you know anyone who has?
No, ma'am.
What about people who are afraid of the cost of, say, an ambulance?
Okay, that happens all the time because we have so many Americans that don't want to go in debt and they're trying to save money.
Hey, guess what? That's the freedom, though, right? That's the individual freedom to fucking die. Spending on U.S. healthcare has grown steadily, rising from $2,900 per person in 1980 to $11,200 per person in 2018, measured in 2018 dollars, a 290% increase. Yeah, we got to pump those numbers up, baby. It's not good enough.
So what would you think if that service was free?
If that service was free, anything that's free, sometimes it's not worth having.
54% of doctors.
That's that, what we were talking about, that knee-jerk reaction. If it's free, it's socialism and communism, and that's bad. Because for the past 70 years, ever since the end of World War II, that's what we have been fighting against. Socialism and communism. The great evil to capitalism. And this person themselves admitted, yeah, people are afraid of the ambulance because it is expensive. And if it were free, that would still be a problem. And it's that disconnect, that cognitive dissonance that needs to be addressed first. And that is one of the goals of this stream. And the reason why I do the professor hour in the beginning and some laid back approaches to it where we listen to the news and then we listen to creators while playing a game. There's only so many different ways that you can peel back those layers without browbeating somebody into it, right? Because if I sat here and I was like, not that I have a book or anything, but like, you have to read this book or else you're wrong and you're evil, nobody gives a damn. And if I'm just up here losing my mind, why am I any different than Hasan? Just watch Hasan then at that point, right? If I'm all over here being, swearing like a sailor like I normally would talk anyway, and gesticulating and all this, and it's like, people are so stupid, it's not hard, free things are tax dollars, right? There's enough of that. But there's a certain segment of the population, like that little old lady there, who would not be receptive to, lady, you need to stop thinking so stupid, right? They're not going to be receptive to this. And it's not like I'm trying to cater to that particular denomination, right? That denominator. But there is a difference between being taken seriously and being correct, and not being taken seriously but still being correct. And sensationalism only gets you so far. If sensationalism is what people expect, they are not going to take you nearly as seriously. And when you try to then use that as your source to try and convince others, say, for instance, you're on the fence of socialism, communism, universal healthcare, right? You're on the fence, like, I think it's a good idea. And you hear me talking like this, with this background, with this, accordance, and talking about the real issues, the facts, how it can be resolved, what we could do in terms of policy, and that we can contact our congresspeople. You'd be receptive to that. Maybe you'd listen to Hasan and be like, that's awesome, that's where it's at. Now you go to your conservative uncle, your conservative parents, and you present them my take versus Hasan's take. Who do you think they're going to respond to better? That's one of the ways we can peel back the cognitive dissonance. Each generation has their own way of dealing with it. And even young people might prefer a more nuanced approach. That is one of the reasons why content creation is so vast. And it's why there are the storytellings, the documentary people, the streamers, the reactionaries, and then the people who are trying to bring it in from the point of policy, right? And then there's the theory people who make me look extremely exciting. I know. So it's all about the approach. But all of us are trying to achieve the same goal, which is peeling back the cognitive dissonance. By being confrontational, however, and there is a time and a place for it, typically in debate, if all you do is have viewers come, tell them that they're stupid unless you agree with you, and then they move on, the only thing you've created is an echo chamber. I don't want an echo chamber. I should probably build one. It would probably make me more effective as a streamer. It would probably help me build my channel and my platform faster if I was a Hasan. If I was dressed like this and still acting crazy, and still being as articulate as I am. But it's the principle of the thing. I want people to come here, stay here, subscribe. Subscribe actually means money. Follow is what I meant. Subscribe to my YouTube. That's free. I want people to be a part of the conversation. I want them to be engaged in the conversation. I want them to take something away from the conversation and be able to share that information with others. I want to build a movement. I want to truly build a platform and an organization that can actually get other people elected, that can actually provide the talking points, espouse the talking points, and be able to approach them from a left-leaning or a right-leaning position. Because Democrats are not liberal. They are not leftists. They are not typically supportive of these ideologies. They are on paper, right? The Democratic platform is pretty left-leaning in all things except execution. And then, of course, you have the conservatives, which are on the exact opposite side anyway. So if you're in rural Kentucky and you're dominated by conservative people and you want to run for office, I don't care what level, and you want to talk about healthcare and ways to improve it, first, you have to run as a Republican. Second, you have to talk about the issue. They're not going to listen to you if you say you're a Democrat, and they're not going to listen to you if you say you're a Democrat and talk about Medicare for all or universal programs. But I can tell you from my personal experience running for Congress in Ohio's 1st District, as a Republican, that whenever I approached other Republicans, other voters who were Republican, and I then said words like universal health care, education, Medicare for all, they were receptive. They might have argued with me a little bit and said, well, but they were receptive. I was able to have the conversation. That is the message. That is the process that I want to create with this channel, and obviously through the YouTube channel as well.
Doctors in the U.S. report getting medication for patients. That seems normal. Would the increase in tax for socialized healthcare and the average amount you pay for health insurance now essentially be the same amount? No. You would be getting money back in your pockets, especially if you're making less than, I think, like $200,000 a year. What was it? Under the Sanders plan, I believe that Sanders Medicare for All plan, you would literally be saving money on the average health insurance cost that you'd be having to pay. You guys have to pay for an ambulance too. The ambulance side of it is completely privatized with like very little help from local funds. So the ambulance part of it is like way more expensive.
77% of people in Britain support the NHS and are happy with it. Would you say that you are happy with the United States healthcare system?
No, definitely not. That's a loaded question. I have insurance, and it's good insurance through my husband's company, but we pay through the nose for it.
And only an American hog would be like, that's a loaded question. Like, it's not. It's like a regular question, idiot. Like, you could just say yes, dumbass. The only reason why you think it's a fucking loaded question is because you understand intrinsically that, like, no, it's not. It's actually fucking dog shit, and you're forced to fucking pay for that. But because, like, something just beamed information in the back of your fucking brain that you literally cannot, like, remove yourself from, where you have to say, America number one, healthcare, baby, we're so good.
Which is a long and aggressive way of saying cognitive dissonance.
Because everyone fucking told me it was good, but when I was growing up, insurance companies should have nothing to do with your healthcare. Americans boggle my fucking mind. It just sucks, dude. It actually just sucks. It's fucking dog shit. Especially when you got a lady that's like literally in the fucking Medicare sweet spot talking shit about socialized medicine. It's like, dude, you literally take advantage of socialized medicine. Like, you actually fuck.
So, and I don't know if he's gonna flesh out that point a bit more, but that goes back to the cognitive dissonance discussion, right? And of course, that's a loaded term. You would never approach somebody and say, excuse me, sir, your cognitive dissonance is preventing you from understanding the nuances of health. You're going to get punched in the face, right? Cognitive dissonance is a term that we need to talk about and understand, and we need to apply to the situation at hand. Correct. Please, for the love of God, do not walk up to somebody who's right-leaning and be like, your cognitive dissonance is keeping you from understanding that, because you'll get hit. You're just going to straight up get hit. But it is, again, part of the propaganda and what we have been led to and fed our entire lives to knee-jerk react to anything that sounds socialist or communist as bad. Meanwhile, Medicare is the Medicare and Social Security are the most popular programs in the United States. They are publicly funded, and they are social programs. That is exactly what they are. Just like K through 12 in most places is publicly funded as well. That is social programs. Now, what are social programs? Socialism. That is fundamentally what it is. And do you know what the most funded socialist program in America is? The United States military. The Department of Defense in its entirety is the largest socialist program in the country. And it is constantly being fed even more dollars. And if you don't believe me, ask a serviceman if they have to pay for housing, food, or education, or medical expenses. Oh, I'm a veteran. You don't. If you're on base, you pay for nothing. There's base housing, you pay for nothing. Literally nothing other than utilities. And if you're off base, guess what? You get per diem. Well, I'm sorry, not per diem. You get housing and food allowance, BAH and BAS. They might have reworded it since my time in the military. And then there's cost of living allowance if you're in expensive areas like Los Angeles. So the military will provide their service members the funding to live in the area in which they live, i.e. are stationed, without having to pay for healthcare or education, while providing both, I might add. So yes, it is 100% socialist. You get free job training, you get free room and board during that training, you get upgrade training, you have guaranteed promotability, access to promotability, it's transparent. It is literally the #1 socialist program in America.
Are on Medicare, which is like the most popular healthcare system in this country. And the reason for why it's the most popular healthcare system in this country is because it's for old people, and old people vote. Unimaginably popular in comparison to anything else. I'm on Medicaid and got to find jobs and pay under the table so I still get free healthcare. Yeah, that's the other part of this. Like, Medicaid is for people who are poor enough to, qualify for it. So it causes people to like literally fucking get paid under the, undercover, just so they can continue getting Medicaid. Because like if they make over a certain amount, all of a sudden they're paying so much more fucking money for healthcare. Especially if their jobs don't provide that healthcare, they still might get fucked. It just sucks, dude. It absolutely sucks.
It do. And that was Hasan's take on healthcare. So I would say we largely agree on all of the major points. There might be some nuance where we disagree, or an approach to the discussion that we would obviously have different. But overall, Hasan has the correct take. What do we got here? This is where authoritarianism comes. Okay. Well, I'd like to stick to, you know what? It's winding down to the end of the stream here. So we could just watch whatever this is.
My beard sucks.
I would prefer maybe yet a slightly different
One of the main reasons men are embarrassed by their
content
beard.
creator, but
everything that you've learned about anti-Semitism literally stems from this. An anti-Semitic text purported to describe a Jewish plan to achieve global domination and to document the minutes of a late 19th century meeting attended by world Jewish leaders, the elders of Zion, conspiring to take over the world. It is the Brothers Grimm of anti-Semitism, yes. Like, it is where dude, right there, like, that right there is straight up. And it was, like, mass delivered to any fascist who would listen. This is why I do personally believe that while Nazi Germany, the Third Reich, fell apart and Nazi Germany lost in World War II, fascism absolutely won. Fascism as an ideology, as an ideological tool, was immediately we love taking up the mantle of all of that nonsense. We absolutely have genuinely continued that tradition, both in our domestic affairs, certainly, and absolutely when it comes to our international enforcement. Have you seen what is going on in Germany? I have. You know what? I'm actually going to point to this right now. I wanted to show you something very funny. Nathan Tankis went to the closed screening of The Commandant's Shadow last night, where he had by far the most disturbing experience was the Auschwitz commandant Rudolf Höss's grandson, Kai Höss, and his Christian evangelism for Israel. If you want to understand where we're at, if you want to understand where Germany's vibes are at, there's two videos I want to show you. One is like the liberal.
Did not realize we were just going to go straight up into that heavy topic. And again, he's not wrong. Right-wing extremism has been increasing in Germany lately, which is extremely concerning considering the Holocaust is one of the most widely talked about atrocities globally, and it was Germany who committed them. And fascism was coined during World War II by Mussolini, who said that's what his government is. And yeah, we can also argue that what we're experiencing today in America is fascism, because fundamentally the merger of the corporation and the state is the definition of fascism. That was a little bit heavier than I was expecting. Let's instead find ourselves another healthcare video. Not to say that I'm unwilling or unable to handle that conversation. I figured we would wind down the stream a little bit, not amp it up a bit more. Yowza.
There's nothing more powerful than you making your thing happen. Really going for it.
The Joe Rogan experience.
The Joe
and
Rogan
then
experience.
Healthcare. Like,
if given 24 hours, can produce $2,500 in cash.
Jesus Christ.
Well, I guess we're listening to Joe Rogan.
They did like regular chemistry lab on him. That's like about a $12 blood test, and gave him like, I don't know, 250 to 500 cc of IV fluid. That was it. What do you think the bill was?
$1,200.
I don't remember it because I'd have to look at the post I put up. I think the bill was $6,000, of which we owed $2,000.
That's insane.
That's problematic.
That's a real problem.
Yeah, it might have been more than that. $6,000 bill. Our insurance somehow picked up maybe $3,500. We were stuck with $2,500. Now, juxtapose that with the following fact. Fewer than 50% of Americans today, if given 24 hours, can produce $2,500 in cash.
Jesus Christ.
So when we say healthcare is the leading cause of personal bankruptcy, it's the first, second, third, fourth, fifth. Like there's nothing else matters besides healthcare when it comes to personal bankruptcy. I mean, this does infuriate me to no end. Like I sometimes think, like, is there any other problem I would ever be interested to devoting my full attention to besides the problem I work on now? That's the only other problem that would tempt me.
You know what's interesting too? If that problem was really tackled by our government and they did it in an efficient way, one of the ways they would have to do it, one of the ways they would have to address it in order to be efficient would be to encourage people to become metabolically healthy.
Of course.
Which we have zero.
So, all right. Started off pretty good. It took 1 minute and 51 seconds for me to roll my eyes. And I'm sure all of you would be rolling your eyes too when you get around to watching this. Being fat, being out of shape, nutrition deficiency and all that fun stuff play a role in your health. They do. Obesity is actually the largest nutrition-based health problem in the world now, instead of hunger and starvation, which is a testament to, capitalism arguably reducing the cost of food or making it more accessible, but also making it less nutritious. when you have conglomerates controlling our food supply, taking out nutrients, denying seeds, GMOs in the sense that it's steroids and causing massive problems and stress to the animal, which absolutely impacts the quality of the meat. And then you have to pay a premium to actually get viable health food that actually has health benefits. You're missing the point entirely. It's not that people aren't trying to eat healthy, it's that people can't afford to eat healthy. And the government needs to regulate that in the sense that we need to break up the different conglomerates that are controlling the food supply. But if this is going to get into fat shaming and all this other stuff, people are big boned. I have a tummy right now. But otherwise, I'm trying to get sure I have all my nutritions through supplements and all that. If we didn't have to rely on supplements, we would be healthier because it would be in our food already like it was before. For instance, hemp used to be fed to our livestock. And that was one of the reasons why we had significantly less healthcare problems back in the day, because we were eating the meat that was infused with the now I forget the chemical, of course, now that I'm trying to, but you get the idea. CBD, it was infused with that intrinsically with the meat to enough that it would actually benefit society. So we're talking again about economics. We're talking about industry. We're talking about regulation. And if we're not going to have that conversation, if they're not going to address that, then they're just fat shaming, and that I have a problem with.
Encouragement. Zero. In fact, there's actually the opposite. There's encouragement for people to have body positivity and to not be
so
fat
we're getting into
phobic
the fat
and
shame.
to not fat shame. You know, and there's zero discussion about healthy diets and vitamin supplementation and the benefits of that. If they just did, like, imagine if the government was responsible for our healthcare, and they realize, hey, guys, like, we got a real problem here. We're spending too much money and we're losing money because what if the amount of money that they made was dependent upon the percentage of money that was spent on healthcare? Like, imagine if politicians, if their salary depended on the, like.
See, but I fear that would still get screwed up, because then they would.
I actually have no idea what he was trying to say. If politicians' salaries were based on healthcare spending, and we've already established that healthcare spending is $8.5 trillion, then they wouldn't be incentivized to make it any more efficient. They would just be incentivized to make it more expensive. What you should do is tie politicians' healthcare to a national healthcare system and not allow them to have private access to healthcare in any form or fashion. That would be the way to tie politicians into the healthcare system and legislation.
Just cut costs, right? Like, I feel like.
What if that wasn't an option, though? What if,
well,
like,
the problem
there was
is
like
we
a
have to
standard
cut.
of
We
care?
have to cut costs. This is the problem, right? We're probably up to $10,000 per capita, which is. I mean, we're actually probably more than that. We're probably $12,000. We're at 2 to 5x every other developed nation in what we spend on healthcare.
But why?
And we get worse outcomes. Okay, so the big reason comes down to made-up numbers. Look at my ER example.
I mean, you're not wrong.
The blood test cost, the actual cost of ordering that blood test is $12. The bag of IV fluid is probably $38.
It's actually $2.
So why do they inflate the cost so much? It's because they play a shell game with the insurance company.
That is true.
So they say, we negotiate different rates with different insurance companies, and we're gonna build up the price enormously, but we're gonna offer you a really big discount, and we're gonna make you our preferred network. We're gonna be your preferred network, and there's a quid pro quo here, which is the price is enormous, but you don't actually have to pay that much. We're gonna discount it to you. But if somebody comes in out of network, which we were, right? We were out of network because probably our network is optimized around being in Austin and not in San Diego, you're going to get screwed. And of course, if you don't have insurance, forget about it. You're paying the fake money price.
Especially if there's a real injury.
Oh, yeah.
A real injury, you need surgery, and you're not insured. Oh, my God.
The other thing is we don't have the same laws around like drug pricing, right? So drug, the United States basically.
So The good news is a lot of these creators, podcasters and all that are talking about the correct issues. And it seems like even on I think Joe Rogan tends towards conservative leanings and guests. But even so, he's having somebody that's actually talking about the issue properly. So it's encouraging. It's definitely encouraging to see that. But it does make my portion of this a little repetitive because, I mean, I don't like saying the same thing over and over again. I don't want to bore you guys either, but, you know, there could be other viewers, so I suppose I need to get over that, don't I? So what they were saying is that we need to adjust the costs, that there's, you know, that there's no regulation on the costs, and that other countries do have those things. And as I said earlier, that is a step in the right direction, regulating the cost, but it needs to outright not be for profit. It needs to outright not be in the private sector. The only way that that's ever going to be effective, the regulation, is if the industries who are producing the pharmaceuticals or who are running the hospitals aren't in charge of it in any way, form, or fashion. They need to be public. They need to be public funded so that the incentive is a public incentive and not a private profit one. And until or unless that happens, regulation isn't going to be very effective because they'll just find loopholes for it. Or they'll just bribe politicians to make exceptions, i.e. carve out loopholes.
Subsidizes the rest of the world in drug pricing. So we, in exchange for getting first dibs on the best drugs, we pay a higher price for them. And other countries are basically not going to pay that. Because
so that's the other thing, right? We pay the most for drugs and we get first dibs. We could literally import the same exact drugs from Canada, import those same exact drugs, and it will cost us factors of the cost less. Like that is the truth. That is actual reality. That say insulin, for instance, if we imported insulin from Canada, instead of paying $300 a vial, or it costing however many hundreds of dollars a vial or whatever, it would be a fifth or a third or a quarter or a tenth. And that's obscene. Hello?
You also have better purchasing power. So if you look at Canada, for example, like the government is buying the drugs, not the payer, right? So it's a totally different system. And the challenge is no system is going to be perfect, but what really bothers me about the discussion is we're missing the point that there are three variables that need to be optimized around. And everybody just talks about their favorite one. But you can't talk about one without talking about the other two. Because if you pull on one lever, you got to let up on one of the other levers. So the three levers are cost. How much does it cost to deliver this care? The second is quality. How good is the care? And the third one is access. How many people fall through the cracks? So if you look at the United States, we're very good on quality. When we deliver care, it's the best. There's a reason people come from all over the world here when they need their cancer surgery, right? We are certainly at or above the best for everything that would be done in medicine. On cost, we are absolutely the worst. There's literally no country that pays more than we do for a given service.
Wow.
And on access, we're horrible for a developed nation. Horrible, right?
On cost, like what is the difference between, like, say, United States
and Canada?
Yeah.
2.5x, I would bet. Wow. Maybe 3x.
Look that up. Let's look that up real fast. And cost of care in Canada versus US. Of course, I don't think I typed that very well. Cost of health care. Here we go. It isn't 2.5. As of 2022, it was around half. It wasn't a 2 or 3x. It was just half. We spend twice as much as Canada, and we get significantly less out of it. It's abysmal. We'll go ahead and finish this Joe Rogan.
Yeah. That's so crazy.
And then we'll wrap up the stream.
Like that.
Right.
Like that's what's...
So Canada is killing us in cost. They're killing us in access because everybody's covered.
Yes.
But we have better quality. So you have to. So that's the trade-off. Like,
right.
I mean, I do talk about how my mom is getting largely veterinary medicine in Canada. I mean, like, her healthcare is horrible as far as I'm concerned.
Yeah,
totally
I've had
unacceptable.
Many friends in Canada that have complained.
No, it's totally unacceptable.
So they have bad care, but
at
it's
least
more
everybody gets it, and it doesn't
everybody
cost you
gets
any
it.
money.
And it's
Well, that's a misnomer. It's not that Canadian care is bad. It's that the quality, i.e. the accessibility of technology and drugs and whatever else, is less than that of the United States. But again, as he was, the other guy was talking about, was the levers: cost, accessibility, and quality. We have the best quality, the highest cost, and the least amount of accessibility. So that makes it the worst healthcare system altogether. If Canada is balanced between cost, quality, and accessibility, then they are outright better. And that's what is disingenuous about this comment.
Is it bad care because the physicians are not incentivized to provide better care because they don't make as much money?
No. So first of all, I mean, at least I don't know if I don't want to speak out of school because I'm so far removed from it. But when I was growing up, they had introduced salary caps. So physicians' salaries were capped. So when you hit your cap, you stopped working for the year. So high-earning surgeons would stop working in August because they'd hit their like let's say the salary cap was $300,000. If you earned $300,000 by August, you weren't going to get paid anymore.
So they would just sit down and sit out the rest of the year.
Yep, and come back in January.
It would create this real problem where there was a bottleneck.
Shortage of docs.
Yeah.
But the big...
So, yes and no. And to that point, it was what I was saying earlier about if healthcare workers are overworked, then you're reducing their quality and their accessibility. So we have to not necessarily expand the healthcare premise. And if we're going to do that, we need to incentivize people to get into these fields. And I think that's what Canada was attempting to do, is like, hey, you only have to work 8 months out of the year and you can make $300K, and then you have a 4-month vacation as long as you budget accordingly. And so what you could do is have a better rotation on surgeons and other healthcare providers and workers. But again, if you are not providing for that infrastructure, and if you're not taking care of your healthcare workers, it doesn't matter what technology or what drug you have or how modern your facilities are. If your people that are doing the job aren't here all the way, you're gonna suffer. And that's why an ideal system is overstaffed, funded correctly, with the highest amount of quality care available, and universal accessibility. That is the hallmarks of the perfect healthcare system. And every other country is getting close to some areas, but not all.
Bigger issue is just that the government is in charge of what gets done and what does not get done. And there's sort of shortages, right? So if you, like things that you and I take for granted, right? If you tweaked your knee at jiu-jitsu tonight, you go get an MRI tomorrow. That doesn't happen in Canada. In fact, in certain provinces, it's illegal to have private clinics where you can go pay out of your own pocket to get an MRI expedited.
Oh my God, it's illegal?
Illegal. I think Ontario is one of those provinces, by the way.
Okay, so this is where we get into the right-wing stuff. We'll go ahead and fact-check it, though. Is it illegal in parts of Canada to get private care? Private insurance for medically necessary hospital and physician services is illegal in only 6 of the 10 provinces. Nonetheless, a significant private sector has not developed in any of the 4 provinces that do permit private insurance coverage. Okay. That's private insurance, but I don't believe that is access. So let's look at that. Where are we? Okay. If your employer doesn't offer a private health insurance plan, you can obtain one on your own. It's not even talking about it. Okay. It is not legal in Canada, but they still do. Okay. So this looks like a pro-private healthcare page, which is fine. The rhetoric, though, I take umbrage to. It's not that the government, it's like there's a quota for how many people can get seen for their tweaked knees. It's that there's only so much funding and resources, as they just discussed, because of the salary caps. And the way to address it would be to just overstaff. If you know your surgeon's only going to work 8 months out of the year, but you only hire one surgeon, you're just going to assume nobody else is going to need a surgery in those 4 months. That's stupid. So, again, the argument that private healthcare allows for better access and faster turnaround times isn't necessarily accurate either, unless you're actually paying for an actual private doctor to literally come to you. Because other than urgent cares, that doesn't exist in America either. Unless you go to an emergency room or an urgent care, that's not an option. And they have those in Canada as well. So let's not get it twisted.
Really? Yep. So Toronto.
In Toronto, I do not believe it is legal to have private medical clinics where you can pay out of pocket. So this is where, when people say, oh, we should just be like Canada, I'm like, no. We should do something Canada does. We should have universal coverage.
And then have the option.
And then you have the option to bolt on.
Yeah. But would that be sort of like public defenders versus a really good attorney? Like, because some
I don't think it would be.
Suck.
Yes, of course. No, I think one of the things you have to do is provide primary care and emergency services for free, because that's where 90% of your care would be delivered.
And is the problem that because of the
actually 90% of the cost of care is long-term treatment? That's more of a nitpick. He's not wrong. That's most of the care that should be provided to the general population is your general care and emergency care. That is what the healthcare infrastructure exists to do. But the costs of care are predominantly in long-term chronic type cares.
These made-up numbers that you discussed earlier, that these people in this country at least are accustomed to charging these exorbitant fees, like $6,000 for a bag of IV.
Oh yeah, look, I mean, I got a colonoscopy every 3 years, so I had my last one this time a year ago, and because it's funny, that one should have been covered. I don't remember the details on it, but because I was over 45 at that point, so it counted as a screening colonoscopy. But I've historically always had to pay cash for my colonoscopies because I started doing them when I was 40. And the cash cost of getting a colonoscopy at like one of the best guys in New York City, who I've always gone to, is $2,000. That's the fully loaded cash cost. That means that's covering the facility fee, the anesthesia, his fee, etc. The one I got here in Austin, where I did it through insurance, the fee was $6,000. I got the bill. And, my insurance picked up, maybe this is the one anyway, my point is my cash out of pocket was almost as bad as the cash I paid for just a full up cash one. It had a whole bunch of made up numbers. I actually called my gastroenterologist, the guy who did it, and I was like, you got to walk me through this. Because I'm struggling to understand these costs. And he couldn't really explain it. He's like, yeah, I mean, I don't know. I don't.
But see, that's another, and this is the end of this particular video, so I think we're good. We'll go ahead and, this one. We'll go back to here. So that's kind of the thing. These costs that insurance companies charge or provide or what have you are literally just made up stuff that has nothing to do with the actual care. And when it comes down to what you actually have to pay out of pocket, it's as if you would have gone to somebody directly who wouldn't have charged you all that fluff in the first place. Which is why I'm glad they were having the discussion They were talking about the individual issues of our healthcare system, but it's a cumulative problem. You can't just may regulate the cost of care across the country, and then that resolve the predatory nature of insurance companies. You can't just regulate the insurance companies and not address the lack of consistency of cost of care. There's just, you can't address the healthcare worker shortage purely and then not address the fact that insurance providers and the cost of care are whatever they choose to be. So I think this is a great synopsis. This was actually a very good conversation. I was expecting something more conservative. That's why I chose it. But it wasn't, as it turns out. I wanted to be able to highlight and debate and contrast what I've been saying throughout this stream with the prevailing arguments. That being said, I think this is a great stopping point. I think we covered a lot of ground. I hope you'll take a lot of information away from this conversation in this stream. I hope you feel more informed and have a better understanding of what our healthcare system is and how it can be improved. And as I said before, one of the things I definitely encourage is for you to contact your representatives. And although I should have saved this, I didn't. So we will pull that up real quick again. Contact my representative. There are many different ways to do so. You can just go to www.house.gov/representatives and you'll find your representative that way. You can go to USA.gov, Congress.gov, commoncause.org. No, I'm sorry, commoncause.org, USSenate.gov, citizenscourt.org, and csni.org. There are a myriad of different ways to contact your representative, and what you should do is request passage of legislation that is for universal health care, sponsorship of legislation for universal health care, or something along those lines. And in fact, one of the things I will probably do as time allows is create videos that'll be either scripts or prompts for these various call to actions. Because what we need to do is take back our democracy and figure out how to become civically engaged. It's one thing to say, contact your congressman. It's a completely another to know what to say to your congressman. Just, you're stupid, isn't going to get anything done. I want universal health care now, without any nuance to it or any greater information. Maybe it's just simpler to say, I want Medicare for all now, and I want you to sponsor the bill. That is a great step. It isn't the step that we want, but we can take some sort of win at this stage in the game. So, with that being said, thank you for joining us. Thank you for being a part of the stream, and I hope to see you tomorrow.